we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honoré, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he's the founder of Operation Hope. Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach Deborah Owens, Dr. Corey Abear, Patel Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Cardle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Bernice Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Bradeboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with The Root. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malveaux, economist president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon McDougall, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi, Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Folks, we talked about the whole issue of testing and also this impact on African Americans. Well, again today at the White House coronavirus briefing, it came up, and the Surgeon General, Jerome Adams, made some comments. So we're going to play those comments first, and then we're going to play the second part was a question that came from Yamiche Alcindor of PBS, where she asked him to clarify those particular comments. And so we want to talk about with our next guest and our panel the issue of testing as well as his comments. And so this is what the Surgeon General, Jerome Adams, said today.
And I want to close by saying that while your state and local health departments and those of us in public service are working day and night to help stop the spread of COVID-19 and to protect you regardless of your color, your creed, or your geography, I need you to know you are not helpless. And it's even more important that in communities of color, we adhere to the task force guidelines to slow the spread. Stay at home if possible. If you must go out, maintain 6 feet of distance between you and everyone else, and wear a mask if you're going to be within 6 feet of others. Wash your hands more often than you ever dreamed possible. Avoid alcohol, tobacco, and drugs. And call your friends and family Check in on your mother. She wants to hear from you right now. And speaking of mothers, we need you to do this, if not for yourself, then for your abuela. Do it for your granddaddy. Do it for your big mama. Do it for your pop-pop. We need you to understand, especially in communities of color, we need you to step up and help stop the spread so that we can protect those who are most vulnerable.
That did not quite sit well with a few people. Yabish Alcindor noticed that. She then, later in the news conference, asked this question.
Thank you, Mr. Surgeon General. Thank you. I have a quick question for you. You said that African Americans and Latinos should avoid alcohol, drugs, and tobacco. You also said do it for your abuela, do it for Big Mama and Pop Pop. There are some people already there are some people online that are already offended by that language and the idea that you're saying behaviors might be leading to these high death rates. Could you talk about whether or not could you, I guess, have a response for people who might be offended by the language that you used?
Well, I use that language because that's the language. I've been meeting with the NAACP, with the National Medical Association, with others. I actually talked with Derek Johnson multiple times this week, the head of the NAACP, and we need targeted outreach to the African American community. And I use the language that is used in my family. I have a Puerto Rican brother-in-law. I call my granddaddy granddaddy. I have relatives who call their grandparents Big Mama. So that was not meant to be offensive. That's the language that we use and that I use, and we need to continue to target our outreach to those communities. It is critically important that they understand it's not just about them. And I was very clear about that. It's not just about what you do, but you also are not helpless. We need to do our part at the federal level. We need people to do their parts at the state level, and we need everyone, black, brown, white, whatever color you are, to follow the president's guidelines, the coronavirus guidelines, and do their part. Because when I talked to the NAACP 3 weeks ago, it's important to note that one of the things they asked me was, can you help dispel the myths in this community that people actually can't get coronavirus if they're black? That was a myth that was out there that's actually very important for us to squash here.
And that all Americans avoid tobacco, alcohol, and drug use at this time?
Absolutely. It's especially important for people who are at risk and with comorbidities, but yes, all Americans. So thank you, and I will clarify that. All Americans need to avoid these substances at all times. I put out a smoking cessation report in January. I put out an advisory against youth and pregnant women using marijuana last year, and that was not directed towards any one race. That's everybody needs to do everything they can to be as healthy as possible at this critical time. Dr. Fauci, would you add anything?
Yeah, I think you said it perfectly, Jerome. Thank you. Would you like to add anything to it? Because you are really, you expressed it very beautifully before.
No, I mean, Jerome, you did it beautifully. I can't do it any better than that. And I know Jerome personally, and I can just testify that he made not even a hint of being offensive at all with that comment. I thought that was appropriate. Thanks.
And I can tell you, Jerome has done a fantastic job. Our Surgeon General. I just hope nobody steals him and he goes.
Gotcha. I don't care what Trump has to say. Don't give a damn what he has to say. That's why we don't show any of his comments. All right, folks, joining us right now is Dr. Ebony Jade Hilton, Associate Professor of Anesthesiology and Critical Care Medicine at the University of Virginia. Also on our panel is Dr. Neon B. Carter, Department of Political Science, Howard University. Dr. Mustafa Santiago Ali, former Senior Advisor for Environmental Justice, EPA, and Rob Richardson, host Disruption Now podcast. All right, Dr. Hilton, I want to start with you. First and foremost, I want to deal with you with testing, okay? Donald Trump says, oh, no, look, we don't need any national testing. And he talks about how great we are, how wonderful we are, how we're doing a great job. But the numbers simply show he's a liar. The reality is other countries have done a much better job of testing a higher percentage of their population, and they have a better understanding of this virus than we do. Yes or no? Yes.
And that's a full sentence. I mean, when we're talking about testing, it's just like Representative Thompson said. When we're looking at the sheer volume, 2.2 million sounds like a lot of tests. But when you take that into consideration with how many people we have in our population, that's only for 1 million people, 7,000 tests. And I'll tell you the effect of that. If you look at in South Carolina, for instance, where I'm from, right now, the number of confirmed cases that they say they have is about 3,065 confirmed cases. However, if you look at the South Carolina DHEC page, they've done a great job, and I want to applaud the people who are actually running this website, because what they say is that we have 3,065 confirmed tests, but we have a total of 21,290 presumed positive people. And the reason why it's presumed positive is these people have symptoms, but they don't have access to the test. And that is a problem.
And we're seeing these stories at the Hilton of more people going to the doctor, trying to go to the hospital, getting turned away. There's a bus driver in Detroit. He ends up dying. A 65-year-old black woman in Atlanta, not showing any signs of symptoms. She later dies. And we're seeing that. And again, all of these promises. I'm still trying to figure out where's the drive-through testing that was promised at CVS and Walgreens and Walmart and using these parking lots. And then Trump's like, no, we're not going to do it. And so we're sitting here, and to be perfectly honest, I think most people, we have no idea who the hell has it. And it's just, and the people who say, well, this is no different than the flu. No, guess what? If I see you hacking, wheezing, coughing, I'm like, keep your ass on that side of the room, okay? Right. With this, you can't tell if somebody has it.
Exactly. And that truly is one of the problems that we see. And what we know, too, what we have to take into consideration is they oftentimes say, oh, stay at home, as if people have the privilege of being able to stay at home. 1 in every 5 African Americans literally cannot do a remote work. They can't take their work home with them. And we know that just like this virus kills, so does poverty. And if I cannot feed and keep shelter over my family, if I don't have a choice in that, then what do you expect me to do? You know, this administration has lied on many different levels. But even as far as 2 days ago, they made an announcement that they were going to start to hold federal funding for these drive-through testings. And we haven't even reached a peak in New York at this point. You know, we keep saying we've reached this peak, and yet they had the highest death count yesterday, and their counts are still climbing. So we haven't reached a peak. So how are you even attempting to consider withholding funding for drive-through testing? It is absolutely negligent, and we need people. And when I say people, I expect Dr. Fauci. I expect Dr. Adams, who is also a fellow anesthesiologist. I expect you to hold truth to truth. We took an oath to first do no harm. And so we cannot dance around the truth. We have to start stating it as a fact and put a period on the end of it, and then stop the sentence.
I want to ask you this. I'm going to bring in my panel after you respond to this. And so you heard what the Surgeon General, Jerome Adams, said there when the question came up regarding African Americans. And then he makes this point about don't do drugs, don't do alcohol, things along those lines. Then Yamiche asked him, because a lot of people have been offended. In fact, this is what Reverend William Dr. Barber said in a video that he posted immediately after hearing these comments.
Hello, Roland, and to all of your audience. Let me first of all, Roland, thank you for what you continue to do to push truth and justice throughout this country and literally throughout the world. You know, we are in a difficult moment, and I wanted to come on today as a pastor and as a bishop first, as we examine where we are. I was deeply troubled today when the Surgeon General constantly tried to use and invoke the name of the NAACP as he suggested to Black people that the reason we are dying and catching this virus more than others has to do with our need to stop drinking and smoking tobacco and using drugs, and not addressing the evils and the drugs and the drunkenness that America has had with racism and with inequality. And the fact of the matter is that Trump, Pence, and many of the other Republican governors and legislators have actually exacerbated the denial of health care all over this country, the denial of living wages, the very thing that public health PhDs, public health specialists tell us, that the pandemic spreads through the fissures and the wounds that have been created by historic racism and the criminalization of poverty. We cannot stand for that. I hope that, and I've said that to the leadership of the NAACP, that they can't use us like that and wrongfully use it. I know that's not our position, but to attempt to do that on worldwide TV is ugly, and to attempt to do it as an African American is beyond disrespect. And for Pence and Trump to buy into it, it doesn't matter how many African American leaders they may have talked to today, which they claim they did. They talked and did not listen, and they really believe that they can continue to disrespect our communities, even in the face of dying. Now, in addition to that, I wanted to.
All right, so I'm going to hold those comments. He has some additional comments about churches this weekend. I'm going to hold those comments. But Doc, your thoughts on what he had to say? And again, Surgeon General, did he slip up? Did he make a mistake? Was it smart to later have to walk that back and clarify it?
No, it wasn't a slip up or a mistake. It was stated, and I took offense to it personally, and several different things. For one, Dr. Fauci and President Trump, you can't tell if you're not the targeted population of an insult, then you can't tell us whether or not we can be offended by it. Point number two, being that African Americans typically are always given this stereotype that it's our lifestyle choices that are leading to us having these incidences of worse outcomes in health, but yet we at this point have a national crisis of an opioid epidemic, and it's not treated in the same way, and it's not spoken to in the negative light in the same way as what impacted Black and brown community. The third point was that he mentioned that he talked to the NAACP 3 weeks ago. Now, 3 weeks ago, we were dealing with deaths of maybe 500. Today, we have deaths of over 18,000. And so if you haven't reached back out to the NAACP or the Congressional Black Caucus, of which I've been in contact with Congresswoman Bass and Representative Robin Kelly, who've been absolutely fantastic. They literally hold town hall meetings pretty much every week. There's something going on of where they're trying to reach the constituents to say, what do you need so we can form these policies? So if you haven't reached out to these groups in 3 weeks, then I'm gonna need you to go ahead and make a schedule. And then the final point is you cannot talk about all these comorbidities that they are linking to and saying we're at higher risk for. You can't talk about those unless you are willing to also get on that stage and point out and address the systemic racism that has set up every platform. And if we're talking about drugs and alcohol and the lack of mental and social support, then talk about the fact that we don't have any hospitals and clinics that are put into our communities. Talk about the fact that if we're talking about these chronic respiratory illnesses and asthma that our children are dealing with, then talk about the fact that industries are targeted towards the Black and brown and the lower income level communities and polluting our air and polluting our water. If you're going to talk about hypertension and diabetes and obesity, talk about the fact that there's no sidewalks within our community or that there's no eateries and we have this food apartheid where we can't buy any fresh food and groceries, but we can go to the corner store because that's all that was put there from the redlining from 1930s on. So including from his president. So if we're talking about all those things, I hold Dr. Adams responsible as a fellow anesthesiologist for one, but I hold him responsible as take away my white coat. At the end of the day, I'm a Black woman trying to do what's best for my Black community. And what I know about Black people is that we're honest people. We work hard to promote community at all fronts. We've always banded together to take care of ourselves and to take care of not only ourselves, but other people. And to suggest that we are the cause of our own hurts and not that we are the victims of the system that was set up for us to fail in the first place, I feel like it's personally a slap to the face to the African American community that will always be there to support you.
Dr. Nyambe Carter, your thoughts?
I mean, similar to the doctor, I thought that was very irresponsible. And even the way he framed it as if you do these things, then this disease will go away. And we know that isn't how viruses work. And I think the insult was like the big mom and the abuela, like, don't try to use this sort of code switching language as if Black people and Latino people and other people don't understand what you're saying. We know that shelter in place is important, but we also know that Black people have jobs most of the time that they can't telework. So they're going to be at work They're going to be on public transportation more often. They're going to go back to communities that don't have access to adequate healthcare facilities. And we know that there's also on the other side of that physicians and others who are making decisions about who these people are and whether they're worthy of tests and whether they'll be compliant and all these other things. And I think for him to say it this way was just really irresponsible and almost single Black folks out, because as the doctor rightly points out, we're talking about lots of other communities that use illicit substances way more than Black folks. And yet you didn't tell them to stop using their drugs, to stop drinking, and to stop smoking to stem the spread of this virus. And I think the health issue is being lost in all of this, because you don't want to take responsibility for ultimately why these communities are finding themselves sicker and dying more often from this disease than other folks.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Nope. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they basically about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, it gives you that flower effect like that. But if I wanted to also, unlike because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to rolandsmartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's rolandsmartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at rolandsmartin.com/pocket squares. So please do so. And of course, it goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's youtube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to rolandmartinunfiltered.com. You can make this possible. Eric, I want to bring in Congresswoman Lawrence. First of all, Anthony, go back to my iPad. I want to credit Joshua Bickle. He is the photographer who shot this photo. There are a lot of journalists out there who, frankly, putting their lives on the line, actually covering the news. There have been journalists who have been infected, some who have died from coronavirus. Let's bring in Congresswoman Brenda Lawrence. Congresswoman, glad to have you back on Roland Martin Unfiltered.
Thank you so much. I'm glad to be here, and I thank God that you're safe we're well.
So we're watching these idiots in Michigan who are angry with the governor because she's extending the shelter in place. I mean, Michigan is seeing significant numbers. I mean, there are people there who are dying left and right. I talked about Willie Wilkerson, the longtime fiance and worker with Aretha Franklin, who passed away. I got the news earlier this week. I mean, this thing is real, and these folks act as if, oh, this is no big deal. Let's go back to having groups and people going into restaurants and going to hang out. I mean, Dr. Birx just said this is highly contagious, but they're getting their cues from Donald Trump, who is itching because he's angry the stock market has lost so many of his points.
So this is what's so ironic. The protests that they had today, they were literally without masks, congregating, spitting and hollering, waving the Trump flag and wearing the Trump hat. And what was so ironic is that the organizer of this protest said that it's not political. It's not political, but here you are waving the Trump flag. And so I just want to make this real. In Michigan, we have had over 27,000 people infected and 1,796 deaths as of Tuesday. This is real. This is not political. And this governor has gone above and beyond. And thank God she has, because we're finally seeing that it is leveling out. And it was just crazy today to see this mass people, and they just blocked the streets and protesting and saying, we need to go back to work. So what does that waving the Donald Trump flag have to do with you losing your life? And this is another thing. In Michigan, we have what we call up north. It's wooded, it's beautiful, it's lakes. We call it God's country. And so many people own property up north. And so a lot of people wanted to get in their car and drive up north and get away from this contaminated area. So the governor said, no, shelter in place. You cannot go up north. And they're saying, well, why? Some of those small towns only have one hospital within 50 miles. Can you imagine? Our hospitals here in the city are at capacity. The morgues cannot even handle the crowds. And so now you're going to take your infected disease up north and start infecting people with no resources. So I'm very proud of it. She said that unless you have the responsibility for life or sustaining of life, stay at home. And I support it.
Again, Anthony, go to my iPad. This, of course, is a Periscope video that was shot of this protest. And again, you're seeing these people. 79% of the virus is in 3 counties. Get the other 80 counties back to work. They're acting as if that we have an understanding of the protest of what's going on, and we don't. We don't have a full understanding because testing has not been as widespread as it should be. Congresswoman?
That is the problem, because we have not tested everyone. And the fact that we have stopped this social mingling where we could spread it even faster, and that's the step we want to go to now that we're leveling out, that we can do more testing. Because what we have found is that by the time people have these symptoms, and let's talk about the symptoms in Black people. So for me, I'm an African American. I'm older. I'm over 60. And I have a pre-existing condition. Now you take that, if any of this disease gets to me, it has a direct impact. There are some people that are walking around with no symptoms, but they're spreading the disease. And so now we have the opportunity to keep everyone at home, test those who are demonstrating the fever, the coughing, the shortness of breath, to get health care to them. And now we're going to start expanding it. We actually in Detroit now have a drive-up testing center in the city of Detroit. where you can get in your car. If you don't have a car, you have these symptoms, we'll send a cab for you to test you and get you into the hospital. And what I'm seeing there is not even healthy. Do you know that congregating, all they need is one person to be infected, and they could infect. We don't even know how many people one person can infect. The numbers are not even there yet, and so it's so sad.
Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders.
John Hope Bryant, he's the founder of Operation Hope.
Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Hebert, Patel Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Deja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris. Joby Benjamin.
Dr. Alexia Gaffney, infectious disease specialist. Dr. Georges Benjamin, executive director of the American Public Health Association.
Malcolm Nance, family medicine physician, Dr. Jen Caudle. Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University. Congresswoman Yvette Clarke from the state of New York.
William Spriggs,
AFL-CIO economist. Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Bernice Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Braveboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with The Root. The Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King.
We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. Roland Martin Unfiltered. All right, folks, let's talk stimulus checks. About 80 million people received their stimulus payments this week. But if you weren't one of them, it doesn't mean you won't get your money. The problem is if you didn't get your check, it's because the idiot wanted his signature on it, so therefore it was delayed. There are also technical glitches with it as well. We've also seen the video out there of some individuals who didn't realize that the people who prepared their taxes, the checks went to them. It's been all kind of confusion out there. Try to clear up some of that confusion is Deborah Owens. She's America's Wealth Coach. She joins us right now on Roland Martin Unfiltered. All right, Deborah, so explain to people how that works, how
the people who prepared these folks' taxes, or where they went to places and they actually paid them, they couldn't pay their taxes, and so they in essence got a tax loan, and how those people are keeping checks. That's happening all around the country.
Yes, well, it's not unusual in our community, right? Because we're being bombarded with this marketing around get your tax return, your check early. And so we often fall for that. And so what happens is typically they're giving you a loan. I mean, freedom ain't free. So they're giving you a loan. And then when they get that check, they repay the loan. And then, you know, basically you sort of gave them proxy over your return. And so it's not the money came into their account. It didn't go into yours. They actually had your bank account information. And so in that regard, I think there are a few things people need to know what to do, right? So we don't have to file our 2019 taxes until July 15th. So if you electronically filed your taxes in 2018, then the government has that information. So then you will get that check much easier. The other thing you could have done was filed your taxes for 2019 and got the money electronically. However, if you go to irs.gov right now, you can go ahead and enter your bank account information so that you can electronically receive your $1,200 stimulus check. Now, there's some other snafus in there as well. It's like if you they said if you didn't owe the federal government money, you would get your check, but there is some consternation around that as well. Banks are a little frustrated because they're getting notices from creditors saying if they deposit that money in the check, so let's say you maybe had a lien against your account, or someone, maybe you didn't pay a bill and they went to court to get some kind of garnishee on your check. Some of the banks are fighting out about this, but this is the sort of thing that these are the types of situations that could really hold up you getting your check quickly.
All right, so if you get your check, should you pay your bills with your check immediately?
Well, here's what I'm telling people. The bottom line is it's about keeping your cash reserve. And so, one of the things I want to really encourage people to do is to call your creditors right now, and particularly if you're laid off, and tell them that you're laid off, or, because of the coronavirus, you don't have the cash flow, and see if they'll give you 60 to 90 days. You'll be surprised. Many of the people I gave that kind of call to action a couple of weeks ago when the whole stimulus package, we knew that those checks were coming. And a lot of people were able to negotiate with their creditors to extend the amount. And I think the other thing underneath that is, can we get the credit agencies to go along as well and not make it so that it's a negative check mark on your credit rating? But I really hold on to your cash, people. We don't know how long this is going on. I mean, I was just listening to your conversations, the testing. They haven't tested. I don't know about you, but I don't care if they test or not. I'm not going out here, until I feel confident that I'm not just going to willy-nilly get coronavirus, right? So you can open up all of the locations you want, but if people don't really feel safe, they're not going to do it. And so in that regard, cash is king. Keep as much liquid cash as you can, because we don't know how long this is going to go. When I say liquid, I'm not saying, put it in a mattress or anything. I am saying put it somewhere where you can have easy access to it.
All right, then. Any questions from Tiffany or Lauren for Deborah Owens?
Deborah, are we paying taxes on that money, on that stimulus check?
That's another snafu. There has been some back and forth around whether or not that is taxable. For all intents and purposes, it is taxable income. But for many people, here's what I want to say at the end of the day, is that if you were in a position that you did need that stimulus check, consider yourself grateful, right? And for those of you who are receiving it right now, I mean, it would be great if that was a tax-free check, But I know many people out here are suffering. They've maybe been laid off. So there's some other tips that I want to give folks, Roland. They have funded food banks to a greater degree. I think you saw the lines that are in many cities of people who are going for food banks. Really, folks, don't be ashamed to get help. The other thing, and I don't believe many people are taking advantage of this, but part of that stimulus package went to states to increase the amount that you could get on unemployment. And so you need to file for unemployment. You may not think you qualify for it or whatever. Let them tell you no, because you will get your state's minimum, and then there's another $600 tacked on to that. So that's another way to get some cash flow. Another part of the stimulus bill, I know we're hearing that, the paycheck protection money is gone, and that was really for small businesses to keep their employees employed. But there's some other layers to the stimulus package. You could have applied for an economic disaster loan, and what many people didn't realize was whether you qualified for that or not, underneath that, what you could have applied for was a $10,000 grant. Grant meaning you don't have to pay it back. The other aspect of this stimulus money, a lot of people are self-employed, and they may have thought that they didn't qualify to apply for some of this money. When last Friday, if you were able to take, whether you had no employees or all, but you had 1099 miscellaneous income taxes, income reported, you could file all of those, and then your payroll, if you will, would have been 2.5 times whatever your monthly income was.
Got it.
Please, folks, we hear that the money is gone. Still continue to apply, because if the Congress does, negotiate for more money, you want to be first in line. So here is all I want to say, Roland, is if you snooze, you lose. So this is your money. These are taxes that we all pay. They're not giving us anything.
Right.
We're simply getting a return on our dollars. And the more we have, the easier it is going to be for us to sustain ourselves, because we don't know how long this is going to take.
Real quick, Tiffany, final question.
No, I don't find a question. Deborah, I have a statement, because you just said if you snooze, you lose. If folks want, it's not about Congress negotiating the money. Again, that is our money. If folks want to see an increase, or folks want to receive a check, the Democrats are suggesting or recommending that folks get $2,000 a month moving forward, because you're right, we do not know how long this is going to last. Folks need to call their elected officials and tell them their stories and the conditions that they're going through, so that Congress and the president can move quicker to get folks more money, because $1,200 is not enough to last folks, considering the conditions of what we're seeing, to last folks for as long as this is going to be.
Absolutely.
Well said, sis.
All right, Tiff, we appreciate it. Deborah, tell people where they can get more information from you.
Yeah, they can go to wealthyu.com. And by the way, we've got an all-day masterclass going on tomorrow. Folks can still get in on it. They can go right to wealthyu.com. We've got a great promo code to help folks. All they have to do is put virtual, just virtual, the word in, and they get 50% off. So thanks again, Roland, for having me.
Appreciate it.
Get your money.
All right. Deborah Owens, thanks a bunch. I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications. And of course, Lauren, you have this idiot tweeting to people to basically rise up in Minnesota, in Michigan, in Virginia.
Yeah. He's trying to get the organic support, the grassroots support, to put the pressure on governors that, frankly, he wants to control in terms of opening the government so the economy can get back on its feet, and he won't get blamed for a bad economy in the election. The whole thing is PR, as usual with him. The reason he does the daily press conference is that's his messaging. He gets to stand up there and lie. Millions of people see him lying, and he knows that. And he knows the networks are, for some reason or another, they're starting to figure it out.
Every single night. We've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders.
John Hope Bryant, he is the founder of Operation Hope.
Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Hebert, Patal Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward, Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris, Joby Benjamin,
Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association,
Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York,
William Springs,
AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie British Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with The Root. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi, Mario King.
We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. You can make this possible. Welcome back to the news conference. Dr. Fauci speaking. Go.
We have multiple different countries that have gone through various phases of their individual outbreaks. And you could learn something from them about where you are in your own outbreak. For example, when China went up, what happened is they just didn't turn around. They went from going to, I'll just take an arbitrary number, 500 new cases a day. The next day it was 1,000 cases, then 1,500, and then 2,000. But once the number of new cases each day starts to flatten out, that's when you get to that point where the inflection goes down. So what things we want to look for, the things that Dr. Birx had mentioned. That doesn't mean you declare victory when it does that, but you know you're at least on the way to where you want to go. And I think that's really very important. The third and final thing that I think gets back to the question that many of you in the audience have asked of us is about, would this possibly become a seasonal cyclic thing? And I've always indicated to you that I think it very well might. And the reason I say that is that what we're starting to see now in the Southern Hemisphere, in Southern Africa, and in the Southern Hemisphere countries is that we're having cases that are appearing as they go into their winter season. And if, in fact, they have a substantial outbreak, it will be inevitable that we need to be prepared that we'll get a cycle around the second time. What does that mean for us and what we're doing? It totally emphasizes the need to do what we're doing in developing a vaccine, testing it quickly, and trying to get it ready so that we'll have a vaccine available for that next cycle. In addition, to do the randomized controlled trials of drugs so that we will have a menu of drugs that we have shown to be effective and shown to be safe. Because I know we'll be successful in putting this down now, but we really need to be prepared for another cycle. And what we're doing, I believe, will prepare us well. Thank you.
Thanks, sir. We'll take a few questions.
Mustafa, point there again. Let the damn experts lead.
Mm-hmm. I mean, Dr. Fauci, everybody has a lot of respect and trust that he's always going to give you some real talk. And then, you know, whether it's good news or challenging news, that he's going to share it with you in a very straight sort of way. But the other part that he shared, you know, when he was talking about numbers and using the example in China, you know, we got 360 million people in this country. And so far, you know, we've just had a handful of folks who are being impacted when you look at that larger number. So we need to get prepared. We need to make sure that social distancing is something that we're incorporating in a real way. As they say, we need to flatten out the curve. But we've also got to be extremely focused on our most vulnerable communities because they are the ones that are going to get hit extremely hard. Lives will be lost, but also long-term types of situations are going to come out of the needs that are there around folks in economic situations, their health, the costs that are going to come out of this. So we got to just be focused.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Nope. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, you know, it gives you that flower effect like that. But if I wanted to also, unlike other, because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, it goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's YouTube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. You want to support
support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. Welcome back to Roland Martin Unfiltered. Alicia, can you hear me?
Yes, I can. Hey, Roland.
All right, then. You, of course, you used to be a state official, but you're also running for, is it county commissioner?
Yep, Hamilton County Commissioner in one of the swing counties in the nation.
All right, so tell us about what's happening there, the new rules they have in place when it comes to requesting a ballot and voting on April 28th.
Yeah, well, first of all, you know, our primary was cut short, and they stopped it just 12 hours before the primary was supposed to begin. So a lot of people didn't get the information. A lot of people showed up at the polling location and was turned away. And so then they put out a different date and found out that the governor did not have the authority to give a new date, and that date was in the June. Then they came back to the Ohio legislature and came back and said, listen, we'll allow voting by mail only to be extended until April 28th. However, in order to do this, there are two steps. One, the voter must request a ballot. So you have to fill out a request form and get it back to the Board of Elections. Once you do that, then they will send you a ballot to your home. Once you get it at your home, though, you must fill it out. Now, all of this has to be done with timelines. Request forms have to be in by April 25th at noon. And then the ballot, you got to hope that the ballot gets to you in time. You have to fill that out and get it back in the mail by April 27th. All ballots must be at the Board of Elections by April 28th. So you've got timelines, you've got deadlines, you've got a two-step process. Most people had never voted by mail. When you look at the numbers, African Americans mostly voted in person, whether they early voted or were at the actual polling location. And so we have been working very hard to educate people and make sure they have access to the ballot box. And we've been doing that independently. It's unfortunate that even my own party, the Democratic Party, has not put emphasis. And I have said, wait a minute, if we're going to say we're going to vote by mail, say in the general election, and we're promoting this, we've got to start training people how to do this. And so one of the things we've done, we are in an in-shelter except for essential things. And so we declared that voting is essential. And so one of the things that our group, the Ohio Voter Bill of Rights, as you know, been involved with, got 100,000 signatures, et cetera, for voting rights. What we did was a lot of people don't have printers at home. So we printed out all the ballots. We put them in the community where people can have access. So when you go out and get your toilet paper, we were able to work with Kroger's as well as the Board of Elections. And so they're in Kroger grocery stores. We put them in African-American-owned businesses, gas stations, soul food restaurants where you can get carry-out so that you can have access. And then we brought together and worked with the churches. As you know, Souls to the Polls is huge, but we created a new Souls to the Polls. And we started last weekend, and we're going this weekend, this Saturday, where we've got pastors and churches, and we're coming together to have a no-contact drive-through only. So you don't go in the church at all. You drive through like you drive through a fast food restaurant. You drive through, you stay in your car, you fill out the form, it's the request form. You keep your PIN. We have gloves and masks, and then we make sure that your request form gets to the Board of Elections in time so that you can be mailed your ballot. And so this is our Voting is Essential campaign. And I think we're going to have to do these kinds of things around the country.
And also, I also see the AARP is also going to be printing out ballots for people as well.
Yes, printing out the request forms, but here they haven't really received them. You can't really depend on the mail because even here on the ground, the U.S. Postal Service, we've got temps that are in because people are afraid. Some have gotten sick. So we have, not just depending on the mail, we have folks in the community that have to go out and get their medicine and so forth for seniors. We're asking them to help drop off their applications as well.
All right, then. Alicia Reese, we certainly appreciate it. Thanks a bunch. And let's encourage people in Ohio and other states that will be voting very soon. Get your absentee ballot so you can vote in that primary. Alicia, thanks a lot.
Thank you, Roland.
Appreciate it. Thank you very much. I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.
It's time to be smart. When we control our institutions, we win. This is the most important news show on television. Any racial background, y'all put 2, 3, 4, 5, 10, 15, 20, 30 on this and keep this going. What you've done, Roland, since this crisis came out in full bloom. Anybody watching this, tell your friends. Back and look at the last 2 weeks, especially Roland Martin Unfiltered. Hell, go back and look at the last 2 days. You've had sitting United States senators today, Klobuchar and Harris. Whatever you have, you can bring to Roland Martin Unfiltered to support it. Please do, because this information may literally save your life.
Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland. Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. Roland Martin Unfiltered. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. You can make this possible. All right, folks, there's a whole lot of misinformation circulating on social media about how to protect yourselves from COVID-19. You got these people walking around, wrapping themselves in trash bags, going to grocery stores. I don't know what the hell. Some people talking about you can eat garlic to prevent infections. All right, joining us right now is Dr. Sadrina Calder, a board-certified preventative health physician. Doc, how you doing?
Hi, how are you?
I'm doing great. All right, so you hearing a lot of this crazy stuff out here, and then you got people who coming up with their grandmother, grandmama, granddaddy, back in the day remedies, all this sort of stuff like this here. In fact, I had a tweet a little bit earlier. Even Trump, all the lying that he did about this particular drug. In fact, he stood before the cameras and said that the FDA approved it. That was actually a lie. FDA did not approve it. They're still sitting here. Again, here it is. The FDA has issued a statement clarifying the chloroquine situation. Trump wrongly said the anti-malaria drug was approved for coronavirus. The FDA statement says there is no approved coronavirus treatment. And so what are some of the crazy stuff that you're hearing out there as well?
So I'm hearing a lot of misinformation just across the board, all over social media, probably on a daily basis. One of the first things I heard was that Black people couldn't get the coronavirus.
That's a lie.
And that, exactly. I mean, we've already seen a few NBA players that have been diagnosed with it. eat your Selba, etc. So yes, that is definitely a myth. I don't know how we came up with that, but the coronavirus does not discriminate against anyone. So,
all right.
Another myth. I'm sorry.
No, go ahead.
Another myth is that antibiotics can treat it. That's completely incorrect. So this is a virus that we're dealing with. Antibiotics are used to treat bacterial infections. So that's definitely not true.
Okay, so what about all these people who again, like we showed these fools who were spraying their kids with I'm sorry, you can't spray your kids with Purell and think that that's going to ward off coronavirus.
I agree. Dousing yourself in disinfectants is not the appropriate way to prevent getting the disease. You can actually be doing harm to yourself. Those are chemicals that you're putting on your skin and potentially inhaling into your lungs. So this is not something that we recommend at all. We continue to recommend the same preventive measures that we've been pushing: social distancing, washing your hands, avoiding sick contacts. If you're sick, keeping yourself away from everyone else and at home. Covering your nose and your mouth when you cough and sneeze. Those are the types of things that you can do to properly prevent it.
What about this? Okay, so first, is there anything that we can do to fortify our immune system that would keep us strong? So even if someone does contract it, you still have a strong enough immune system. Anything we should be taking?
So there's nothing that you can do in terms of boosting your immune system to prevent it from happening, but you can kind of continue to maintain a healthy immune system if you do have one. And that's just by eating a proper diet. So you want to eat enough protein, healthy sources of carbohydrates, healthy fats, get enough sleep. That's a big thing. Getting at least 7 to 9 hours of sleep per night. Exercise.
7 to 9?
Yes.
Hell, that'd be a miracle if I slept 9 hours.
Yeah, I think most people have difficulty getting that amount of sleep, but that is the recommended amount.
Doc, how many hours you sleep?
Brother, half that if I'm lucky. But I'm listening to the doctor. I want to live, brother. I want to live.
Dr. Calder, how many hours you sleep? Dr. Calder, how many hours you sleep?
I'm sorry. I'm still trying to make sure I get to that 7 every day. I have trouble with that as well.
Child, please. Yeah. If I get to 6, that's a miracle. No
question.
Yeah, for me too. 6 is doing pretty well for me, but I'm still aiming to try to get 7 every night.
I got you.
That's something I struggle with now, and I continue to work on. But in addition to that, just making sure you're eating enough fruits and vegetables so that you get all the proper vitamins and minerals that are needed to maintain a healthy immune system.
Folks, for y'all on Facebook or YouTube, you got any questions or Periscope, go ahead and post your question, and I'll ask you real quick. Risa, you got a question?
No.
Erica, you got a question for Doc?
Absolutely. Good doctor, thank you so much for joining us today. Wanted to find out how can we, the general public, communicate the severity of the virus to the younger population. I have a 20-year-old son who's college age, in college. And so in talking with him about it for quite some time, because of spring break and the different things that people around him were doing, he kind of did not understand the global pandemic event that we're in. So in this hour, how do we kind of move forward and not have to, I guess, maybe have as many conversations to really kind of make it understood to them that this virus impacts everyone of every age demographic?
Dr. Calder?
Yes, well, I think it's important that we address one of the myths that is causing, I think, young people to believe that they're not at risk. And that myth is that only older people are affected by the virus. That is definitely not true. We're seeing about 20% of people that are infected with the virus are in the U.S. are in the 20 to 44 age group. So it does affect younger people. And these are hospitalizations, I should mention. 20% of 20 to 44-year-olds are being hospitalized because of the disease. And what young people, I think, don't understand is while they may not be at higher risk for severe illness if they're healthy, or death, not as high risk as 65-year and older individuals, they are at risk to pass the disease along to people who are unable to deal with it. So yes, you may walk around and feel okay, but you may be a carrier of the virus and may be passing it on to an older individual or someone with a depressed immune system. So I think that information is what we need to focus on. So that
but you know what, Dr. Calder, I think part of the problem though is, and frankly, we've got to blame all those folks who been at these news conferences. The problem is they said, hey, if you're young, you know what, you're good. And that was a problem. Yeah. Now, all of a sudden, we're seeing these cases of 20 people who are 20, who are 25, who are 28, who are 30. In fact, almost 30% of the people who have been infected with coronavirus of the CDC study between 20 and 44, 29% of them between the ages of 20 and 44. And so the people who are talking have got to stop saying it.
Yeah.
Because it's created this whole invincibility. That's why you got all the people who are out there on South Beach and everywhere else in Florida and other places saying, hey, yeah, we all good, because all they kept hearing is, you're young, you can't get it.
Right. Absolutely, absolutely. I think that is information that we need to really stop saying and stop putting out there at this point, because so many people are being infected with the virus. It's spreading everywhere. It's spreading very rapidly. I think initially the reasoning behind that was to not cause too much fear and hysteria. So I think they wanted to emphasize the fact that about 80% of people that are infected with the virus have a mild or moderate type of illness. But I think at this point, what we need to emphasize is that it can affect people of all ages, including children, and it can be passed on to people who may have severe illness if they were to catch the virus, or who may, have a high risk of death. So I think that's what we need to now focus on, because it's now in all 50 states, and it's every day the numbers are just going up and up and up. So.
Dr. Calder, one of the biggest things that people used to kind of dismiss it is they say that this is just like the flu. And, plenty of people get the flu every year, plenty of people die from the flu every year. Why is this even a big deal? Can you kind of address that a little bit?
Of course. So I know, people do tend to compare this to the flu. I think one of the differences between this disease that we're dealing with and the flu is that this virus seems to spread a lot easier than the flu from what we're seeing. And that could be due to a number of reasons. One of the reasons is because we do have a vaccine for the flu. And while everyone does not get that vaccine, a number of people do. So that helps to keep it from spreading the way we're seeing COVID-19 spread. So I think that's one of the reasons. So because we don't have a vaccine, because at this point we don't have a treatment, that goes to show that at this current moment, this virus, this disease is more detrimental, I think, to the public than the flu is.
Can you also, one more thing, I saw, on social media, there are various athletes and famous people who have been who've tested positive even though they don't have symptoms. And so some of the comments that I've read within those is that people, well, how will why are you even being tested if you don't have any symptoms, or these people are lying, they're being paid to say this. Can you just kind of address kind of people who think that, well, because these people aren't symptomatic and they're positive and they appear to be doing fine, that there's some sort of hoax going on?
Okay, so yes. Well, first of all, there's an incubation period for the virus. It's anywhere from about 2 to 14 days from what we can tell. So you can potentially have the virus for up to 2 weeks without any symptoms. That's number one. So if someone were to test you, you could be positive and maybe just asymptomatic at that point. Secondly, some people are being tested who may have had a contact with a positive. And while they don't have symptoms at the time, they were in contact with someone else who was positive. So just because that person tests positive and they were tested, but they hadn't developed any symptoms prior to testing, that doesn't mean that this is a hoax. It's very possible, and it makes absolute sense.
All right, Dr. Sadrina Calder, we surely appreciate it. Thanks a lot.
Thank you.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right. right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear. So we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, you know, it gives you that flower effect like that. But if I wanted to also, unlike other, because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, that goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's youtube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. We've been hearing a whole bunch of stuff when it's rolling around, all just mess on social media, all kind of different nonsense, myths dealing with COVID-19. And so, you know what? We got to deal with those. And so joining us right now is Dr. Christy McDowell. She's a microbiologist and the CEO and founder of Baby Scientists, Inc. Dr. McDowell, glad to have you here. What has been the craziest thing you've heard, these myths surrounding coronavirus?
Thank you, Roland, for having me today. The craziest one that I've heard recently is blowing your face with a hairdryer.
Oh, my God. We played that dude the other day, and it was just idiotic.
Yeah, it's nuts. The only thing that's going to happen for you by blowing a blow dryer in your face is that you're going to burn your skin and you're going to get chapped lips. Okay? So viruses don't just chill in the respiratory system doing the Cabbage Patch and Bankhead bounce, you know, and like, no, when they enter your nose or your mouth, they immediately bind to the cells in your respiratory system and enter those cells and start doing what they do by infecting them.
All right. What about cold weather and snow will kill the coronavirus?
No, that doesn't work either. No, there's no research out there that shows that cold temperatures or very hot temperatures kill the virus. It's not that simple. It's not that easy. And that's not how viruses work.
All right. How about this one? Taking a hot bath will actually prevent you from getting the coronavirus.
Well, you know what, Roland? I say do take that bath to stay clean. However, it is not going to kill the coronavirus. The viruses, when they enter our mucosal systems, they look for receptors on our epithelial cells that line the mucosal tract, and they immediately bind in nanoseconds. They don't stand around in our throats. They don't chill up in there. They're not walking around looking for, their homie or whatever. They are getting busy. They're getting busy infecting. And what the cells do is the viruses, once they enter, they hijack our cells, replicate themselves, and then lyse those cells, kill those cells. And so up to 100 to 200 virins can be produced from one cell. And just imagine, if you have 100,000 cells in your body infected by a virus, times 200 new virins, that is a lot of virus in your body.
How about this one here? The virus can be transmitted through mosquito bites.
No, that is also false. There's nothing that shows or has been researched that this virus is in the blood. The only thing in the blood that can be detected are your antibodies to the virus. So no, that is untrue as well.
Okay, we saw all these fools spraying their kids with, I don't know what, Lysol and stuff. Also, people are spraying alcohol and chlorine all over their body to kill the coronavirus.
Yeah. No, Roland, that too is crazy, and that too is true. I mean, untrue. So don't spray your kids, spray your counters, spray something else. Don't spray your bodies, and definitely don't spray it in your face or your throat. I've also heard of people gargling with bleach. Now, come on, my people.
Gargling with bleach?
Yes. I saw that today, that on social media, that some people were gargling with bleach. Oh, and another thing that's very false that I've heard is that people will put lemon peels and orange peels in hot water, and they want you to breathe in the steam, and that'll kill the virus. No, the virus is not just floating around in your body, in your mucosal system like that. The viruses don't work like that. So the only thing that steam is going to do is just provide some nice moisture to your nostril tract.
Lord have mercy.
Help with your facials.
Lord have mercy. Dr. Christy McDowell, we surely appreciate you joining us. Thank you so very much for giving us the facts about the coronavirus and what not to do. So people, please stop sending that crap on Facebook and Twitter and Instagram, because we don't need your grandmothers and grandfathers and aunts and uncles and nephews and cousins and nieces doing some of this stupid stuff.
That is very true. Keep bringing the funk, Roland. Keep bringing the funk.
I appreciate it. Thanks a lot.
All right. Thank you.
Folks, this morning I was on Instagram and I came across this video by Pastor Jamal Bryant of New Birth Baptist Church in Atlanta dealing with the whole issue of testing. Check this out. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Is that a lot of journalists who are saying flat out, don't carry a news conference live because of the lies. An NPR station in Seattle, they announced that they're not going to carry his news conference live, saying they don't have the capability to fact check what he's saying because too many lies are being told from the podium.
I think it's a good idea. One of the president's main responsibilities is actually being able to share correct and accurate information with the country, to share what the steps are, where we are in this respective pandemic. And when you have someone who has a very hard time with the truth, it doesn't do anything to help us to move forward. It actually puts us behind the 8 ball, and it makes people wonder if they can trust anyone in the government.
Right now, turn this up. Y'all listen to this. Turn this up.
This incredible, we were having the most successful years that we've ever had in the history of our country. You saw what happened yesterday with the stocks, and today they're up. I'm telling you, if Steve gets the deal done, the incredible incentive is going to take care of people. It's going to take care of our workers. It's going to take care of companies that employ all these workers. Small and
turn
big.
it down.
By the way, I would
here's
say
what's amazing. Here's what's amazing. Go turn that down. Turn that down. Turn that down. So here's what's amazing as you listen to that nonsense. He's talking about how he hears from all. I want to hear a little bit of it. How he's hearing from all these businesses who say they want to get back to work. Everybody wants to get back to work, but nobody wants to die.
So, Vice President's going to stay with you.
Nobody wants to die. If you have a restaurant that's packed,
we'll see you tomorrow. Thank you very much.
You're not trying to die. Pence is going to continue. Fine, we can bail out of it, but you don't want to die.
you're talking about, again, putting people together. We are seeing an increase of the people dying. We're seeing that. And he's also lying. He put out a tweet earlier talking about how we've done more tests than anybody else. Well, if you say we've done more overall tests than any other country, yes, but if you actually did it based upon the size of a nation, we have not. Again, this is the sort of the line that he plays. And again, we're at this point, Mustafa, we still don't know how significant this thing is. I'm going to pull up comedian Kathy Griffin. Comedian Kathy Griffin, y'all. I saw this before I came on the air. Kathy Griffin tweeted out this is what she did. This is in response. So Trump tweeted out, just reported that the United States has done far more testing, go to my iPad, than any other nation by far. In fact, over an 8-day span, the United States now does more testing than what South Korea, which has been a very successful tester, does over an 8-week span. Great job. Okay, first of all, here's Kathy Griffin. He's lying. I was sent to the COVID-19 isolation ward room in a major hospital ER from a separate urgent care facility after showing unbearably painful symptoms. The hospital couldn't test me for coronavirus because of CDC Pence task force restrictions. Hashtag test, test, test. And this is a photo of her from the hospital bed. And so Trump is out here. Let's get back to like everything was. The economy was great. We were just the best in the world, the best ever. But if you're a store owner, do you want 100 people walking through the door? Right. And you don't know whether or not you got the coronavirus? Yeah. If you work in a movie theater, do you actually want 350 people sitting right next to each other watching a movie, and then somebody coughs or somebody sneezes, and all of a sudden the entire movie theater goes nuts because you don't know if somebody's sick? That's why the health people are saying you have to maintain this shelter in place. And some are saying it needs to be national because we don't have a handle yet on how significant this is. And the experts, Mustafa, are saying it's not going to be until April until we think that we've reached sort of the apex to know what we're actually dealing with.
The president, throughout his administration, has continued to place profit over people's lives. We can go through all the various aspects that a presidency has to deal with, everything from environmental issues to housing issues, down the line. But, I'm not sure where the president is getting his information from, because I actually have talked to a number of the leading public health leaders in the country. And many of them, you remember, there was supposed to be a database. And in this database, folks were supposed to filter in the information where the various testing was happening. So there's testing that's happening, at the hospitals, and then other private entities are doing testing. And he also likes to take credit for other people's work. So Governor Cuomo, who has been leading in New York State, has been, guiding the process. And he's actually been forcing and pushing to make sure the testing is happening, looking for the equipment that's necessary for the medical personnel to be able to do their job, in an efficient way. And before that, you had Jay Inslee in Washington State.
Well, again, it is, just for people to understand, go to a split screen. Again, Pence is talking. And the whole point, why I'm going back and forth, because, look, y'all need to hear what they're saying. Go to it. I want to hear what Pence has to say.
The president and I were in direct contact with governors of New York, California, Washington State, New Jersey, Michigan, and others. And we continue to be inspired and impressed by the leadership that governors are providing in their states, making tough choices, leading their states.
So he's talking about how inspired and impressed they are. Yeah, the Daily Beast has a story where it shows that Donald Trump is pissed off because Andrew Cuomo has been critical of him. And Donald Trump's way of doing business is, if you're not nice to us,
then we're not going to do business with you. Exactly the same thing happened with Puerto Rico.
All right, folks, back to our Roland Martin Unfiltered video in just one moment.
All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Nope. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they basically about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, it gives you that flower effect like that. But if I wanted to also, unlike because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, that goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's YouTube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Want to pull the phone right now, Reverend Dr. William J. Barber, of course, one of the national conveners of the Poor People's Campaign. Reverend Barber, it is stunning to watch the sheer and utter incompetence coming out of the White House every single day. You also look what's happening on Capitol Hill, where you have the debate going on there. The Democrats, for the second time, have voted against cloture, and so therefore the bill that the Republicans want them to vote on, they are desperate for that to move forward. Mitch McConnell is really upset, blasting Democrats, talking about how they are, failing America and all of this sort of stuff. In fact, I want to play for you something that Mitch McConnell said that I want you to comment on this, Reverend Dr. Barber. So, folks, here's Mitch McConnell. Check this out, y'all. This today.
On the Democratic wish list over which they choose to block this legislation last night. Tax credits for solar energy and wind energy. Provisions to force employers to give special new treatment to big labor. And listen to this, new emission standards for the airlines. Are you kidding me? This is the moment to debate new regulations that have nothing whatsoever to do with this crisis? That's what they're up to over there. American people need to know it. Democrats won't let us fund hospitals or save small businesses unless they get to dust off the Green New Deal. Well, I'd like to see Senate Democrats tell New York City doctors and nurses.
Reverend Barber, they're complaining because Democrats say there's too much pork, if you will, in this bill. What say you when you listen to the whining and complaining of Senate Majority Leader Mitch McConnell? In this bill, what say you when you listen to the whining and complaining of Senate Majority Leader Mitch McConnell? In this bill, what say you when you listen to the whining and complaining of... Hold on one second. We've got some cross audio going. And so guys, hold on one second. So let's go ahead and fix that. Okay, Reverend Barber, we're hearing some cross audio. So on your end, if they could turn down or just turn down the audio from the show, then we can actually hear you. Okay, go right ahead.
So first of all, Mitch McConnell is lying. One of the main issues is that they want to give $500 billion to corporations without any riders on it, the Trump administration, once again focusing on the corporation and not on the community, not on the poor, not on the working poor, and not on the people who are on the front lines. And he knows that. When he calls it a wish list, for instance, strengthening health care for him is a liberal wish list and not something we need to do to save lives. Making sure people have money. You know, they don't even really want to give the meager amount of $1,000 because in one of the bills, they even make that so that the money that you get went down, the poorer you are. So this is, again, Republicans who want to make money off of people suffering, who believe the answer to every problem is trickle-down economics. Just give it to the corporations. You even heard Trump say he doesn't want to nationalize certain things because, quote unquote, he sees that as socialism, when in fact we have plenty of socialism for the wealthy and the greedy. The other thing is McConnell, if you look at 2 million poor people in Kentucky, and he isn't even looking out for them because all he's concerned about is the corporate donors. That's all he's concerned about. And then the third thing, Roland, what I'm concerned about is, now if McConnell was up there arguing to get more judges that were against a woman's right to choose, you'd have all these white evangelicals and religious folks just jumping and supporting it if he was talking about being against gay people. But when he's talking literally about passing a bill that's going to hurt poor and working poor people and not really protect us and not strengthen health care, you don't hear anything from them. Not one word. What he is doing is a scandalous and sinful use of political power. It is abhorrent to see what it's doing. It's abhorrent to see what Trump is doing, and the fact that one good thing about it, it is a good thing, is that we are seeing in living time that anybody who just says Trump, Trump, Trump doesn't understand the depth of this craziness. McConnell, in some ways, is worse than Trump and more powerful than Trump because the legislation has to come through him. And just getting rid of Trump is not going to be enough for this democracy. It's going to have to be a total reset.
When you look at what the Senate, I listened to some debate earlier, and Susan Collins was railing against Democrats and John Kennedy, and all of them were just railing against him. What, for you, what should this bill look like? Should it be first, let's deal with the workers, or when you hear Trump say, "Oh no, we got to help the airlines and the cruise lines, and we got to help Boeing," and I didn't hear him say we got to help the employees of Boeing. It was like, we got to help Boeing.
Nope, and that's the point. They want to give more money to the same people that took the other tax cut and basically bought their own stocks. That's their solve. But now we have to understand throughout history there have been those who were cynical enough to make money off of people's hurt. There are a lot of people that made money during the Great Depression. When Roosevelt pushed the pass Social Security, there was some that said, don't put it with the agrarian culture and the domestic culture, left out 50% of white women and almost all black people. But you don't hear them saying, let's protect the nurses' aides and the nurses. And I'll tell you another group, let's protect the janitors who have to clean the soil piece. We're talking about people who are at risk. Let's protect the maids. Let's protect the sanitation workers. Let's make sure everybody has a living wage. Let's make sure, and not just for 3 months, but permanently. Let's make sure we make permanent paid sick leave and time off. You don't hear them arguing for those things. It's all about we have to do this $500 billion. Now, remember, that's $500 billion on top of already $1.5 trillion that they found overnight. And isn't it amazing, Roland, that when Bernie Sanders or Elizabeth Warren were talking about Medicaid for all, the whole argument by Democrats and Republicans is we don't have the money. We can't find the money. And isn't it amazing that they want to give all this money to the airlines and the cruise liners, and some of the cruise liners don't even have their offices in America, by the way. But this same group, McConnell, if you go back in history, they were the ones that cut the money to the community health centers. My daughter is a PhD in public health, and she said, Dad, it's not just that we don't have the money, we don't have the infrastructure because of all the ways in which extremists who call themselves Republicans cut community funds, cut hospital funds, block health care, and now we don't even have the infrastructure to deliver what the people need.
So to talk about this digital campaign where the Poor People's Campaign is launching.
Well, we're launching a major digital campaign. We have what's called a moral response to poverty and pandemic, and we put it together with some leading thinkers. And what we should be doing both permanently, temporarily and permanently, is online now. You can pull it. We did it with MoveOn.org. We've had thousands of people to sign on, have 250,000 people the other night come on and go through it, and we've loosed them to call McConnell, call Schumer, call Pelosi. We believe it's having some impact, too, because now Pelosi is saying, well, we're going to write our own bill. You know, we're turning people along digitally. And on June 20th, we now know we have to have a mass Poor People's Assembly and a national moral march on Washington. But we're going to learn from you, Roland. Instead of, we can't do it, that they shut down D.C., no large gathering. So we're going to have the largest gathering online. We're going to have hundreds and hundreds of thousands of people online on June 20th, 2020, mobilizing towards that, putting the face of poor and low-wealth people. We're right now, we cannot wait, Roland, another 2 years to then come back and analyze this and show the inequity. So we're working with 2 think tanks, one out of Harvard, one out of UCLA, and one out of D.C., examining the inequities right now and challenging Democrats and Republicans. And in June, we're going to have a mass gathering to continue to push the agenda we were pushing before the crisis. Here's the last comment, because what we have to say is the crisis did not start for a lot of people in the end of February, March. We were losing 700 people a day from poverty before the pandemic already happened. 250,000 people a year, 140 million people poor and low wealth, before there was ever a germ. The pandemic has exposed the already existing fissures and crisis in our society. And so we're going totally digital for this mass, but we can't. Somebody said, why don't you postpone? We can't postpone. The last thing we can do now is postpone. The thing we must do is stand up and speak out, particularly for the 140 million, 43% of this nation that are poor and low wealth, that are not being dealt with in most of this legislation.
Well, especially since, of course, the election is still going to go forward. I mean, there will be an election in November.
That's right. And that's why we said June 20th. We're mobilizing to June 20th so we can organize after June 20th. We're mobilizing people not only to tell their stories and shift the narrative, but to build power. We have a study coming out. I hope we can release it on your show.
Absolutely.
And that study is going to show what will happen, what could happen if just 2 to 3 to 5% of poor and low wealth people were organized, mobilized around an agenda, and they voted. It could fundamentally shift. In fact, the margin of victory to move McConnell lies in organizing poor and white folk in the mountains and black folk in the cities of Kentucky. And the margin of victory exists among poor and low wealth people who are not voting, not who are voting, who are not voting because they are not hearing politicians deal with their issues, which is why we're challenging Democrats to stop backing up. They need to make McConnell and them have to, if they want to vote stuff down, let them. But don't go in a back room and negotiate out. That's one of the things we have to say to Schumer and to Pelosi. Put a bill together that's what we need. Put it before them and make them vote on it. Don't negotiate poor and low wealth people out and give in to the bullies and the corporations. We can't do that.
All right, then, Reverend Dr. William J. Barber, we surely appreciate it. Thanks for being with us. Anything you need in the future, be sure to let us know. We'll be right here.
Bless your heart. Thank you, Doc.
Thank you, sir. Appreciate it. All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear. So we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, you know, it gives you that flower effect like that. But if I wanted to also, unlike because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, that goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's YouTube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. You give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. Now, folks, Donald Trump spent today whining and complaining on Twitter. Oh, my goodness, they aren't telling me thank you, and they aren't saying we appreciate all that you've done. Really? Really? And now what he's done is he's now shifting the blame to the states. Well, after he was blasting Governor Andrew Cuomo on Twitter, actually was watching Cuomo's news conference and was commenting on what Cuomo was saying. This is so delicious. Watch what Cuomo said back to Trump as he watched him on TV.
Let's respond to the president. First of all, if he's sitting home watching TV, maybe he should get up and go to work, right? Second, let's keep emotion and politics out of this and personal ego if we can, because this is about the people and it's about our job. And let's try to focus on that. I have said repeatedly that when we were fighting for the additional capacity for a hospital system, that the president moved very quickly, and I applauded him for it. and he brought the Army Corps of Engineers, and he brought them up to build the Javits Center capacity, 2,500 beds. He's wrong that it hasn't been used. About 800 people have gone through Javits. To dismiss 800 people is disrespectful. But we didn't use 2,500 beds because we didn't reach the capacity. When he says, well, we built it, we didn't need it, it sounds like suggestion is, well, it was a request by the state that wasn't valid. If he didn't really believe 2,500 beds was necessary, I don't believe the federal government would have helped build 2,500 beds. And the number came from a projection from him. See, he should read the reports he issued. The White House Coronavirus Task Force had enormous, projected in the millions of people. The CDC, which is the president, projected in the millions of people. So the projections were high. They were the president's projections. So for him to say to anyone, well, you relied on projections and the projections were wrong, they're your projections, Mr. President. So were we foolish for relying on your projections, Mr. President? CDC, Coronavirus White House Task Force, that's you, White House, that's you. We relied on your projections. Okay, shouldn't have relied on your projections. Actually, I think the president has a better argument, which is, yes, we built 2,500 beds because the projections said it could get that bad. And because we worked together, we flattened the curve and we didn't hit the projection, which is actually what happened. But don't suggest that anyone made a mistake relying on your projections or on Cornell, Columbia, McKinsey, et cetera. Second, I have said a number of times, I don't know, what am I supposed to do, send a bouquet of flowers? They were very helpful on Javits. They were very helpful on sending the U.S. Navy ship Comfort. They were very helpful in intervening with China and getting PPE equipment out of China. They were very helpful in helping us find ventilators. I said, thank you, thank you, thank you, thank you. Now, going forward, we're still in the midst of it. The president doesn't want to help on testing. He said 11 times. I said the one issue we need help with is testing. He said 11 times, I don't want to get involved in testing. It's too complicated. It's too hard. I know it's too complicated and it's too hard. That's why we need you to help. I can't do an international supply chain. He wants to say, well, I did enough. Yeah, none of us have done enough. We haven't, because it's not over. So yes, thank you for the Javits. Thank you for the U.S. Navy ship Comfort. But it's not over. We have a lot more to do. And no one can take the posture, well, just say thank you for what I've done, and I'm now out. I'm not doing anything else. I've done my part. What if I said to the people of my state, okay, I'm done. By the way, I saved hundreds of thousands of lives. I flattened the curve. I created more hospital beds than anyone ever imagined. I coordinated the entire state. I'm done. I'm done. I'm going home. I'm going to go see my mother. I'm going to spend time with my kids, and I'm going to go out fishing in Connecticut because their marinas are open. That's it. I'm done. What if I said that? That's what he's saying. I'm done. I don't want to help on testing. Testing is too hard. And then the only thing he's doing, let's be honest, well, it's up to the states to do reopen. By the way, it was always up to the states. What are you going to grant me what the Constitution gave me before you were born? It's called the 10th Amendment. I didn't need the President of the United States to tell me that I'm governor. And I didn't need the President of the United States to tell me the powers of a state. People did that. Alexander Hamilton, Thomas Jefferson, James Madison, they are the ones who gave me the power. And I don't need the President of the United States to read the Constitution for me. Maybe he should have read the Constitution before he said he had the power to open the states, where he did a very graceful 180, and many people allowed him to do the graceful 180. But, so he now says it's up to the governors, which he said repeatedly now, yesterday, version of yesterday. And now it's up to the governors to reopen. Okay, I'm going to reopen. I get it. And you don't want to help on testing, which is a national problem and replicates the same chaos that you created with medical supplies because FEMA wasn't ready. By the way, I needed a stockpile. Where was your stockpile? 10,000 ventilators for the nation? That was your stockpile? Where your projections, the federal projections said they would need double the hospital capacity of this nation. Think about that. The CDC says double the hospital capacity of the nation. The minimum projection was 2.4 million hospital beds. You know how many hospital beds we have in this nation? 900,000. His projection says 2.4 million hospital beds. The whole hospital system is only 900, and his stockpile has 10,000 ventilators. You were ready with your stockpile? Didn't you read your own CDC projection? Didn't you read your own coronavirus protection? So, thank you again, Mr. President, for the Javits. Thank you for the U.S. Navy ship Comfort, which, by the way, is just doing your job as president. It's not really thank you like you wrote a check yourself, but thank you for that. We're not out of the woods. We have to go forward. We need help on testing, and we need funding. It's up to the governors. It's up to the states. Will then provide the funding. No, they only want to pass a bill that funds their small business fund called PPE, their small business program. We need to fund the small business program. But you're going to say, after just saying this monumental task is up to the individual governors and the individual states, I'm providing no help, no assistance, no financial money. I understand that small businesses need the funding. By the way, I know that airlines need a bailout, but not the states. Why don't you show as much consideration to states as you did to your big businesses and to your airlines? Right?
Ooh, talk about laying the wood. See, that's what happens when you actually read stuff and you have facts, but clearly Donald Trump has no clue whatsoever. Joining us right now is Dr. Ebony Jade Hilton. She's associate professor, anesthesiology and critical care medicine, University of Virginia. All right, Dr. Ebony, clearly as you heard that, you had to be saying, damn, this sort of reaction I got, damn. It was just like another, damn. Then just another, damn.
I was about to call a timeout. He had time today. He had time today.
And Trump was watching. Trump was watching because he was live tweeting.
Listen, I'd have had to turn that off. We had to fight. I mean, that for me, anybody that knows me, that was life for me, because to read someone for exactly who they are without even having to throw insults, just to give you a mirror and say, hey, look, this is what you've been handing out. Everybody sees it. It's very clear. You're not fooling anyone. But I give him, he had time. He had a Bible to give the hand on. I loved every piece of it. So Yeah, I'm here for it.
The thing is that what you're dealing with right now is Donald Trump wanted these governors to beg. He wanted them to bow down. Now he's doing this. Okay, I'm done with y'all. So y'all, I ain't got nothing to say. So y'all figure out testing. I ain't got no problem. That's what's going on here. That is dangerous.
It's not only dangerous. See, I see Trump for who he is. This is a setup for when it goes bad, I have someone to blame because I didn't open it up. You guys opened it up.
There you go.
And you didn't do it the right way. What we know is that before you can open up the economy, biology will always win. So unless you have testing in place, unless you have a method by which to trace those who are actually positive and make sure that their community is going to be safe and that they have the resources they need to actually isolate themselves and actually still have money to feed themselves and keep a shelter over their head, unless you have the treatments already in place and the hospitals geared up to take care of the people that may come in mass, then you're not ready to open the economy. But what Trump wanted to do was, because our economy is in struggles, and I do know, like I said, virus kills, but so does poverty. So do we have to balance? Yes. But you balance and you open the economy once you have these measures in place. And he knows it's not in place. Dr. Fauci has probably told him this is not going to be good. And so what now Trump is doing is covering his tracks to say, governors, this one is on you. If it's your choice to open it, then go ahead and open it. But as soon as it goes bad, he's going to say, I had nothing to do with it.
Well, he's already said, I take no responsibility at all. And that's exactly what you're seeing here. This whole deal, the federal government, we're not a backstop for ventilators and for equipment. You know, we're not some shipping clerk. Actually, you are. That's why there's an emergency stockpile of all kinds of goods and services for that very reason. Now, when you looked at these orders that they gave, do you believe they make sense? Or do you think what's going to happen is governors, county officials, and mayors are going to say, you know what? That's cute. Y'all set the guidelines. We gonna listen to real professionals who are going to give us the 411 on what's proper and what's just.
Well, sadly enough, we already know what's going to happen. If your state is red, you know what's going to happen. If your state is blue, you know what's going to happen. Unfortunately, what we've seen with this administration is that it has become very divisive, where science does not matter. It matters along the lines of party lines. And so we saw the states that took forever to have a stay-at-home order. There's still some states without one. We know which governors have said, oh, we're going to keep our beaches open, and which one said that our state is going to be closed regardless if you march on my grounds or not. We're closed. So we already know how this is going to go. And so what I tell those people in those red states is that our prayers are with you, and we're going to do everything we can do on the medical end to take care of you. We just have to band together.
I just think that, look, the governors in the regions are doing the smart thing by saying we're going to coordinate amongst ourselves because, frankly, we're not getting any leadership from Washington. And I think you're absolutely right. Donald Trump wants to completely wash his hands of this. He wants to just push it all on everybody else and just, like Cuomo said, just sit back and just go off and do something else, maybe go play golf.
I mean, he did it with the World Health Organization. The World Health Organization, he had reports and memos back in 2019 that said, this is in China. This is what we're up against. Here's a test that you can actually use. And he said no. 12 weeks later, we still didn't have a test that was up and functioning in the United States. And now here we are 2 days ago where he's saying, World Health Organization, is your fault that America is looking the way it looks. And I'm going to defund you right in the middle of a world, like a global pandemic. I don't understand this at all. And just like, Kumo was saying that he wants the 10th Amendment, or talking about the 10th Amendment, I'm looking at the 25th. My question is, where is that one? We need that one at this point in time.
Well, look, I think bottom line is, look, they can call for this, but I think people, until they are able to trust where we are, they're not going to be going out there. And this other deal is, I was looking at some tweets earlier, and that was apparently a call with members of Congress, and Vice President Mike Pence did it, and the Democrats were screaming, testing, 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 and they said that was the most embarrassing call we've ever had, because these people they really act as if there's been enough testing. They announced this week 3.5 million tests. Kayleigh McEnany, a new press secretary, we've done more testing than anywhere in the world. That's not even 1% of the U.S. population.
It's insane. If you break it down, for every 1 million people in the United States, we've tested 10,000. That doesn't make sense at all, considering the fact that we know there are several, as what we estimated, at least 3 to 5 people for every one that we have tested as positive that are positive right now. We just didn't have a test for them to take. And so we are greatly behind the 8 ball on this. I urge people, regardless of if your elected officials tell you that you can go, if you go out of your home, you must protect yourself, not only for yourself, but for your family as well, and for other families, because this thing is not over. We don't expect it to be over until late into the summer, if not into the fall. And so we have to be smart about this process and know that biology will always win.
Yep. End of the day. Simple as that. Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news, because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patel Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, Senior Economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is President of the National Medical Association, President of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, Infectious Disease Specialist, Dr. Georges Benjamin, Executive Director of the American Public Health Association, Malcolm Nance, Family Medicine Physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie British Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with the Root. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. Roland Martin Unfiltered. Absolutely. Now, folks, you may remember my next guest from his Black Panther Challenge, which was a GoFundMe campaign that allowed kids to see Black Panther for free. Well, he launched another GoFundMe campaign, this time to help people pay their rent ahead of April, the due date. Frederick Joseph joins me right now. Frederick, glad to have you on Roland Martin Unfiltered. We were just talking about what Colin Kaepernick is doing, helping people. We're seeing these things happen all over where people are saying, hey, let's help. I talked about what Tyler Perry did, buying groceries for people in Atlanta and other places as well. I mean, in this moment, we're seeing people step up to help their fellow brothers and sisters.
Yeah, it's a dire moment, and everybody has to play their part realistically. I think that nonprofits, governmental organizations, so on and so forth, everybody has to be ready to lend a hand realistically, or we're not going to get out of this. And that means that even if you're not doing the work, amplify somebody that is. If you can't go out and volunteer somewhere, then get the information out to people who can. You know, everybody has to be a part of this movement right now.
And when you look at the giving, first of all, how much have y'all raised so far?
We're at about $285,000.
And how are you then dispersing it out?
So we have a team that's vetting people via social media. So people are sending their requests in to me at Fred T. Joseph on Instagram and Twitter. And we're vetting them via their profiles, vetting them via Google, and using software on the back end to make sure that they're legitimately who they say they are. And then we're sending the money via Cash App, Zelle, and PayPal to get people help as soon as possible, as opposed to waiting for a check or having to leave and go speak to an organization.
And one of the reasons why that's all, I mean, I think back when Tom Joyner created the BlackAmericaWeb.com Relief Fund for African Americans who were impacted after 9/11. And that's exactly what it was. Resources that were going directly to people, as opposed to typically what happens, the people they work with the United Way, the Red Cross, things along those lines. It's like, no. Let's go right to the people and put it directly in their hands.
Yeah, I think that that's exactly right. You know, I've seen a lot of critique online, especially about this effort that we have going right now, saying that we should give the money to an organization. And while I do respect a ton of organizations doing great work, and we raised $40,000 just a few weeks ago for the Food Bank of New York, you know, I think right now what people also need is cash right in their hands immediately for direct relief. You know, for people who can't even get on the subway or afford gas money to get to these food banks, so on and so forth, right? Or people who just need to keep the lights on.
Right.
You know, $100, $200 could be life-saving right now.
Well, absolutely. And I think it's important what you're doing. And again, moment look, we've seen it with our show. We've seen it where our fan base said, hey, you know, I'll be on live. They're like, dude, what's your Cash App? What's your PayPal? Because you're giving us information we're not getting on the networks. We're seeing Black experts, and we've seen that sort of reaction. I think people are in this moment understand how we can help one another and support one another.
Yeah, I mean, you know, the moment is more dire than anything most of us have ever been through in our lives, right? And as a person who's come from a poverty-stricken background, I've seen dire, right? But I've grown up in situations where $20 would have made all the difference, and we could still go outside and try to figure out ways to make that $20. When $20 can make all the difference, but you're supposed to stay at home, what are you left to do, right? What devices are you left to? There aren't any. So we're trying to help the people who realistically might not have another way.
Absolutely. Where can people continue to contribute if they want to, the folks who are watching right now?
Yeah, so anyone who wants to contribute can look for the GoFundMe campaign. It's coronavirus rent relief. And realistically, if that's too hard, people can follow me at Fred T. Joseph on Twitter or Instagram. It's literally plastered all over my social media platforms, or profiles rather, right now. So if you can't donate, please also amplify. And for those in need, reach out.
All right then, Fred Joseph. Man, I appreciate it. Thanks a lot.
Thanks a lot. Have a good
I
one.
want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications. Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Cedrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patel Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie British Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with The Root. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. You can make this possible. To show the sheer ignorance of this man who has an absolute disdain for black women, especially black women in the media. Yesterday, Yamiche Alcindor read Trump's comments back to him that he said and chose to attack her. Watch this.
Mr. President, I have two questions. The first is, you've said repeatedly that you think that some of the equipment that governors are requesting, they don't actually need. You said New York might not need 30,000. You said it on Sean Hannity's Fox News. You said
that why don't you
some,
people act? Let me ask you.
You said
why
some
don't
states.
You act? Why don't you act in a little more positive? It's always trying to
My
get
question to you is,
get you. And you know what? That's why nobody trusts the media anymore.
My
That's
question
why
to you is, how is that going to impact?
Excuse me, you didn't hear me. That's why you used to work for the Times and now you work for somebody else. Look, let me tell you something. Be nice. Don't
Mr.
be
President, my
threatening.
question is.
Don't be threatening. Be nice. Go
My
ahead.
question is, how is that going to impact how you fill these orders for ventilators or for masks? Your
not gonna
views that
impact.
you're not going to. It's not going to
We're
impact you at
producing
all.
tremendous numbers of ventilators. We're doing a great job on it. Mike Pence, our vice president, has headed up the task force, which has been incredible, the job they've done. We have everybody in the White House working on it. We have everybody in the...
Thank you, Mr. President. I have two questions. The first
All
is...
right, so that was that question. And then, of course, today, again, same issue you have here with this truly arrogant individual. Yamiche asking another question, calling her nasty again. Play it.
Per capita, as many people as other countries like South Korea. Why is that, and when do you think that number will be on par with other countries?
Yeah, well,
and
it's very much on par. Look, per capita, we have areas of country that's very wide. I know South Korea better than anybody. It's a very tight. Do you know how many people are in Seoul? Do you know how big the city of Seoul is? 38 million people. That's bigger than anything we have. 38 million people, all tightly wound together. We have vast farmlands. We have vast areas where they don't have much of a problem. In some cases, they have no problem whatsoever. We have done more tests. I didn't talk about per capita. We have done more tests by far than any country in the world, by far. Our testing is also better than any country in the world. And when you look at that, as simple as that looks, that's something that's a game changer. And every country wants that, every country. So rather than asking a question like that, you should congratulate the people that have done this testing, because this administration inherited a broken system, a system that was obsolete, a system that didn't work. It was okay for a tiny, small group of people, but once you got beyond that, it didn't work. We have built an incredible system to the fact where we have now done more tests than any other country in the world, and now the technology is really booming. I just spoke to I spoke to a lot. I'm not going to even mention. I spoke to a number of different testing companies today, and the job that they've done and the job that they're doing is incredible. But when Abbott comes out and does this so quickly, it's really unreal. In fact, one company I have to say that stands out in the job, and I think I can say this, I don't want to insult anybody else, but Roche. Roche has been incredible in the testing job they've done, and they're ramping it up exponentially. It's up, 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 up. And you should be saying congratulations instead of asking a really snarky question, because I know exactly what you mean by that. You should be saying congratulations.
We're talking about a nasty, despicable, shameful, horrendous, narcissistic, smart ass Avis. That's what we're talking about here, who cannot stand black women. He has attacked Yamiche before. He has attacked April Ryan. He has attacked Abby Phillips. It is consistent how he attacks African-American reporters, especially black women.
Absolutely. And I would just add to your list of adjectives: racist, sexist, and idiotic. And he is a salesman. I'm adding that because that describes what he just did. He tried to redirect. He tries to deflect and redirect these questions. You know, it could be that he's just so obtuse he doesn't know what per capita means. I'm going to give him the benefit of the doubt and suggest that he does. And he is intentionally deflecting that question because it undercuts his assertion and his lie that we are leading the world in testing, because we're not. We are lagging. And in terms of how he specifically spoke to her yesterday, using the phrase "you people," and every black person in America knows what that means. And then going from you people to saying that she was basically attacking him is also something that every Black person in America knows, especially Black women, having to navigate this charge of being an angry Black woman when you're just being competent, when you're just doing your job, when you're just being intelligent. When it comes from this vessel, a vessel of Black womanhood is often seen as an attack, especially by people who are weak and less intelligent than you are. And so what has happened with this situation that we're facing is we have in leadership someone who is woefully underprepared for this job, but at the same time, someone who is woefully compensating himself in terms of his sense of self-aggrandation. And he cannot admit that he is incompetent. And therefore, all that he does is try to deflect, dissuade, and lie his way out of every situation, while specifically going out of his way to attack Black women, especially in very foul, vulgar, racist, and sexist.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Nope. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, you know, it gives you that flower effect like that. But if I wanted to also, unlike because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, that goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's YouTube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. There's a news conference going on at the White House. We're not showing it live because Donald Trump really just lies too much. He has to be fact-checked as opposed to just putting it out there. But I'm going to play for something that I think is shameful and despicable. There's this whole deal where he wants governors to essentially kiss his ass in order to receive federal assistance. So go listen to this.
Not appreciative of what the federal government's done, and you've suggested that some of these governors are not doing everything they need to do, like that these governors are at fault. Can you be specific? What more in this time of
Well,
a
I think we've done a
national
great
emergency
job for the
governors-
state of Washington, and I think the governor, who's a failed presidential candidate, as you know, he leveled out at zero in the polls. He's constantly tripping, and I guess complaining would be a nice way of saying it. We're building hospitals. We've done a great job for the state of Washington. Michigan, all she does is she has no idea what's going on, and all she does is say, oh, it's the federal government's fault. And we've taken such great care of Michigan. You know the care we've taken of New Jersey. I think if you ask Governor Murphy of New Jersey, how are we doing? I think he'd say great. I think. He's a Democrat. Governor Cuomo has really said we're really doing a great job. And I saw the news conference where he was thanking the people from FEMA, the people from Army Corps of Engineers this morning. I mean, they built a hospital like in 3.5 days. And it's a big hospital in the Javits Center. And they're building medical facilities in different parts of New York. And Governor Cuomo's been appreciative. But, you know, a couple of people aren't. We have done a hell of a job. The federal government has really stepped up.
What I'm asking is, what more specifically do you want the governor of Washington?
All I want them to do, very simple. I want them to be appreciative. I don't want them to say things that aren't true. I want them to be appreciative. We've done a great job. And I'm not talking about me. I'm talking about Mike Pence, the task force. I'm talking about FEMA, the Army Corps of Engineers. There's no country in the world could have done what the Army Corps of Engineers has done and is doing. Now they're going in and building they're going into hotels and renovating hotels. That should be for governors to do. That should be for states to do. We have the Army Corps of Engineers so teed up and so stocked.
Robert, really? Please kiss my ass.
Well, I think one of the good things and one of the things we can take a lot of solace in as a nation is that they've taken the keys away from Grandpa and just let him play with the radio. What we've seen is that the coronavirus task force headed up by Mike Pence has actually done an outstanding job of getting testing ramped up after initially not being taken seriously by administration. I think since Vice President Pence has been put in charge of the outbreak, we've seen a massive progress in the in triage units and ensuring that we contain the outbreak. Remember when this outbreak started that we were looking at 3% or 3.4% mortality rates for people infected with it. Right now, the U.S. has nearly 100,000 infections, but only about 1,000 deaths, which is right around 1% because of the job that Mike Pence and the task force has done. What we have noticed is, regardless of what Trump says during the press conferences, very little of that actually goes into to policy. And I think there are adults in the room who are actually handling the response, and they allow him to go up and, like I said, play with the radio. He gets to talk, he gets to have his press conferences, but very little that has any impact on the actual federal response. You know, there was a game show host the other day who said they wanted to open up the country by Easter. Nobody took that seriously. There was no action taken by the actual task force that would actually go towards that. So we have adults in charge, and what President Trump says is more so just it's replaced his rallies as being his way of letting off steam and feeling like he's involved.
Jesus, Dr. Carter. I mean, the guy, be appreciative. No, he wants them to kiss his ass. In fact, the governor of Michigan, she did a radio interview where she said that they've had suppliers tell them they can't send stuff to their state, and she's saying that's because Trump has been ripping them. That, to me, is despicable.
Well, I mean, look, Trump has never been known for his temperament. He's never been known to be able to manage much. Even in the best of times, we could count on him to be less harmful. Now we're in the worst of times, and we actually need him to do his job, and he does what he always does, which is if the facts don't comport with his view of the world, he will lie, he will obfuscate, he will tear people down, he will come after people's reputations. And I think the one thing that he doesn't like about governors is that governors are actually executives who are tasked with many of the same things that he has to do. And so in some ways, he's dealing with peers who have a better sense of what's happening on the ground in their states than he does, and he wants fealty. He wants people to beg him, and that's always been his playbook. If you're not around to give him claps and applause, he doesn't really have any use for you, and you would expect him to behave better. But he's not given us any indication that he will or that he can. And it is despicable because this is not what folks need. And again, I mean, well, Robert says, you know, he's largely harmless, but saying things that contradict your public health officials is dangerous. We see what's happened in Mississippi so far, where you have the governor there saying, like, forget these stay-at-home orders and just go about and be in the world, people, because it doesn't really matter. So, yes, it may not become national policy, but we see people who are like-minded acting on this, and that does put people's lives in danger.
Quadricos, it's really, sad to sit there where here you are in a national emergency. You should have you should have folks working together with states. In fact, what you have is a child, a petty, insolent child who is leading this effort, who wants all of the attention, who wants all of the praise, who wants everybody to kiss his ass. And I'm sorry, didn't he win Michigan? He's actually screwing the residents of a state that he won. That's crazy.
Right. This is part of the course with President Trump. We have seen this time and time again. Even when Mitt Romney came back, his coronavirus test was negative. What did he say via Twitter? Oh, I'm so glad he's a rhino, but yet he's positive. This is good for the country. The reality is he is doing much more harm than he is good. We have people in this country, particularly his supporters, who are listening to every word that he says, and they are going out and they are not abiding by the quarantine laws or the shutdowns of their particular state. Again, Dr. Carter mentioned Mississippi, but even when you look at states like West Virginia, even when you look at states like Louisiana, those are largely Trump territory. And because these cases are increasing, it's because they're not listening to him. You have even the person on his faith-based initiative, Jerry Falwell, the president of Liberty University, who actually called the students and the faculty and staff back to the campus. This is one of his key top supporters in his administration. Clearly, they are listening to the president. So that is a larger problem here.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Nope. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they basically about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, it gives you that flower effect like that. But if I wanted to also, unlike because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, it goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? YouTube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's youtube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. You want support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.
I think people don't appreciate, through no fault of their own, is that there are two issues. There's supply and demand. And if you have a supply that can meet the demand, but the supply is not connected to demand, then supply-demand falls apart. What do I mean by that? I mean, there is existing capacity that we have that for one reason or other maybe has not been fully communicated as to the availability of that existing capacity, and you're going to hear about that now. There's production capacity that gets better and better and better. And that's what we're talking about, because for what we need now, we believe that with better communications, we'll be able to make that happen. So I know there's going to be a lot of questions about that. I don't want to go on too long, but let me just finish by saying.
Okay, Chris Metzler, I just need you to explain something to me right there. We need a better communication. You have a task force briefing to the world every day. Is that not? I'm just. You have a televised briefing. You've got a dude tweeting his ratings
every day.
You've got, Chris, the federal apparatus. I mean, do we need to hire a communications intern, Chris? Is Chris there? Okay, Chris is gone.
He needs better communication.
Tiffany, what the hell?
Yeah, he might need a few interns. That's what they need. You got every day a press conference. He just got finished tweeting again a couple minutes ago. He tweets all the time around the clock. I'm not exactly sure what he means by better communication. You know what it is? Maybe he meant him and the president need to have better communication because the president's not understanding his recommendations of what he's saying. And it has been so long that this pandemic has gotten worse that he's trying to send us a message that Donald Trump is not listening and he needs better communication. Because there's no possible way at all that the communication to us has not been clear. It doesn't make any sense.
Lauren, I'm not quite understanding. So was Fauci saying we have lots of supply and no one knows we have supplies? So can y'all please spread the word and send a text and holler at your friend?
They know, there's no mistakes with communication and Donald Trump. Donald Trump is communicating exactly what Donald Trump wants to communicate. And what Donald Trump wants to communicate is that everything is great. We're going to open the country on May 1, and we're going to open in tears, and we're going to get back to where we were. He wants to communicate that because he knows that he has an election in November. He knows that he's got to get things back to where they were and sort of try to figure out a way that he doesn't get blamed for this, which is going to happen anyway. He's communicating exactly what he wants to communicate. Fauci has a problem because, of course, when Fauci tells the truth, that's a problem for his crazy boss, which is why every time they do a conference call, they do these White House task force conference calls like you referred to earlier, Roland, with members of Congress, with governors, et cetera, and so on. And Fauci has to talk in code. And Fauci has to talk in code because he knows that the fools that he works for will likely fire him if he starts telling the clear-throated truth from a medical standpoint about what's going on. Donald Trump is really good at communication. One thing is about him is that he's stupid, but he's not dumb. I mean, he's not a smart man when it comes to the details of anything with regard to policy, but he's very smart when it comes to communication strategy. He knows how to change the subject off into nonsense. He knows that everybody's watching him. He can repeat lies over and over again. And he sort of practices the old adage of if you repeat a lie long enough, people will believe it. And in our elections, there's a certain percentage that will vote for him no matter what. There's a certain percentage of people who vote red and blue no matter what, no matter who it is. He's aware of that. And so he's going to have to probably lie his way through this because the reality is tough. I think the number of deaths now is 36,000, and we're almost at 700,000 diagnosed. We hit 1 million. That's 1 million people diagnosed with COVID is one person out of 320 in the country. It's amazing when you think about that. And that's the ones that we know about. Okay, there's a lot of people we're not going to know about. So Trump understands what's going on here. So he's trying to get things back to the way they were, so he can argue that it was hyped and it was exaggerated. He's a very good communicator, actually.
Well, bottom line is we see exactly what's going on, and he can run away from it. You're right. Everybody wants to dance around it. To me, this is one of those deals where if you're Fauci, that's where you say, I dare you to fire me. I dare you. In this moment, look, stop trying to sit here and, make them feel good. No. You go up there and you say, you go up there and say, I'm going to tell the truth. I dare your ass to fire me. That's right. Yeah, go ahead and fire the leading expert in the middle of an international pandemic.
It likely will.
If you think you got a problem right now, go ahead.
Fauci can hold on to this position. If things get a lot worse and they hit the 100,000 number that was originally predicted by Dr. Birx, and the Surgeon General, then he may, because Fauci is going to have to sound the alarm if things get worse. But it's good that he's back there because you need somebody with a brain in their head back there. I suspect he's not the only one. The question is who has the guts to cross the president publicly. And from what I can see, he's the only person back there that has the guts to cross the president and get fired as a result.
Yeah, that's them
and some of the reporters.
No,
yeah.
and that's my point. You use the fact that you have an 87% approval rating, and you say, I dare you.
That's right.
I dare you.
That's right.
All right, folks. Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patel Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Bernice Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with The Root. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malveaux, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else. in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. You can make this possible. I want to bring in Reverend Dr. William J. Barber right now. Reverend Barber, first of all, glad to have you here. The poor are the most vulnerable right now with what's going on, where you're hearing these stories about people being turned away. When you listen to the White House task force say, hey, the people we're trying to test are those with the worst symptoms, yet we're hearing about people not even showing symptoms dying. I mean, we are, and then you got Trump up here, you know, just so happy with testing. In fact, this was a question that was asked today by Yamiche Alcindor, PBS, and he's just touting how great testing is. Anthony, go to my iPad.
I know South Korea better than anybody. It's a very tight. Do you know how many people are in Seoul? Do you know how big the city of Seoul is? 38 million people. That's bigger than anything we have. 38 million people, all tightly wound together. We have vast farmlands. We have vast areas where they don't have much of a problem. In some cases, they have no problem whatsoever. We have done more. That's very right. I know South Korea better than anybody. It's a very tight. Do you know how many people are in Seoul? Do you know how big the city of Seoul is?
Come on. So now, here's the problem with that, Reverend Barber. One, he's a dumbass. There are not 38 million people in Seoul. There are only 9.8 million people in Seoul. There are 51 million people in the entire country, but he knows Seoul better than anybody else. I mean, we're dealing with sheer incompetence from this idiot in the Oval Office.
Yeah, and you know, from a preacher standpoint, Roland, we're dealing literally with evil. Now, I don't say that too often, but I was reading this morning Zechariah 7:10, where it says, "Do not oppress the widow, the fatherless, the sojourner, or the poor, and let none of you devise evil against other folk." In other words, when you do policies like this, the scripture actually calls it evil. And when you talk about black people and poor people in the South, black and poor, these states were already the states that denied Medicaid expansion because they hated Obama. That means many rural hospitals closed in the South or already undermanned in this process. And so this is total ineptitude and will cause major deaths. You know, my daughter, Roland, is a PhD from Harvard in public health. She's advising the Poor People's Campaign along with Dr. Mary T. Bassett, director of the Francois Xavier Center for Health and Human Rights at Harvard. And listen to what she just wrote me. This is a woman who used to be with public health in New York. She said the absence of a coordinated response from the federal government has left states to fend for themselves and in some cases compete for life-saving supplies. As we've seen with other epidemics, communities that have long been subjected to racist and unjust policies, people of color, people living in poverty, and immigrants will be harmed the most by this botched response. That this response in itself will have a racist impact economically, but also from the standpoint of sheer death. And so once again, we are seeing what someone who is just racist at his core in his policy and backwards in his policy is going to create even more harm in our communities.
And obviously, we talk about forcing states to fend on their own. It's exactly what's happening. In fact, you have states competing for equipment because you've got Trump basically questioning whether they even need additional equipment.
Right. Not listening to because when I have talked, I have three public health people now advising us. They said the first thing you do, Roland, with an epidemic is you put eyes on. So the first thing they should have done is the moment it was breaking out in China, we should have already been over there. We should have already been over there before it ever got here, before the first case, because you have to put eyes on it in order to deal with it. We missed all of that, botched all of that, and notice he's acting like 100 or 200,000 people dying is a good thing. Now, you have to understand that mentality, though. Before this ever broke out, 700 people are dying from poverty every day, 250,000 a year. And he claimed last year that the war on poverty was over, even though 61% of black people are poor and low wealth. So we're dealing with somebody who, and an administration that has, and an ideology that has a long history that really does not value other people's lives, particularly poor people and minority people. You know, when I looked at this bill, you're talking about $2 trillion that he signed last week on top of $1.5 trillion for Wall Street a few weeks ago. Now, think about it. A few weeks ago, they were saying we didn't have money. We didn't have money for health care. We didn't have money for expanding living wages. All of a sudden now we have all of this money for the corporate. And there's a doctrine called the shock doctrine. Lady, you know that book. I think you told me about it. She wrote it in 27. She's a Canadian at 2007. And she said that what happens in disasters, in the midst of the shock, the greedy will use that shock to transfer more money into their own coffers. So what we had last week is $1 trillion bill, no provisions for permanent living wages. 54% of black people make less than a living wage. No provisions for paid sick leave for everybody. A lot of our people work in jobs they don't have sick leave. No provision for health insurance for the uninsured. The majority of the homeless, the undocumented immigrants, the disabled, and prisoners, there was really nothing substantial in that deal. And anybody too poor to have filed taxes, a lot of our people won't even get the basic income that they're talking about you'll be able to have. And then lastly, that bill last week only delays eviction. You know where it says you get to put the eviction off for three months, but the bill is still being added up. So after the 3 months, you either have to have the money that you didn't have the 3 months and pay that. And there was no provision in there to stop people's water from being cut off, even though to protect yourself from this disease, you need warm water and soap.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, you know, it gives you that flower effect like that. But if I wanted to also, unlike because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, it goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered?
youtube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's youtube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. One of the things that I also want to talk about today, of course, in the news conference today, is the constant just lying from the liar in chief. If y'all want to see how this man just makes shit up, listen to this exchange with Kristen Welker of NBC. Check this out.
Follow up, one on the economy and the other on the broader picture here, but just to follow up on my colleague, some people did note that your tone seemed more somber yesterday. You talked about that August timeline. Did you see a projection? Some people thought perhaps that 2 million potentially that could die maybe prompted part of that. Was there a shift in tone?
I didn't think, I mean, I have seen that where people actually liked it, but I didn't feel different. I've always known this is a pandemic. I felt it was a pandemic long before it was called a pandemic. All you had to do is look at other countries. I think now it's in almost 120 countries all over the world. No, I've always viewed it as very serious. There was no difference yesterday from days before. I feel the tone is similar, but some people said it wasn't.
Can I ask one on the economy? Your former economic follow-up.
Okay, so we all know that's a straight up ass lie. Here's a video some folks have put together that just exposes how bad of a lie that is. Go ahead and play it. The video in there.
We have it totally under control. It's one person coming in from China. We have very little problem in this country at this moment, 5. A lot of people think that goes away in April. With the heat, it's like around 12. Many of them are getting better. People die from the flu. It's going to disappear. One day, it's like a miracle. It will disappear. I mean, view this the same as the flu. And we only have 15 people, and they're getting better. Take a solid flu vaccine. You don't think that would have an impact or much of an impact on corona? No. Anybody that needs a test gets a test. They're there. They have the test.
We don't have enough tests today.
It'll go away. I am confident that by counting and continuing to take these tough measures, we will significantly reduce the threat to our citizens.
The number of confirmed cases continues to surge, now closing in on 3,500.
Yeah, no, I don't take responsibility at all.
Man, like, he never thought it was always a pandemic. That's a lie. He just lied.
Well, I'll say this to actually parse what he said. I actually do believe that the president felt like this was a serious thing all along. I don't think
based on what? Based on what?
Listen, I believe that the president felt that this was a pandemic. What the president decided to convey to the public is a totally different story.
Oh, Melanie, that's bullshit. Melanie, please, Melanie, no. I need you to show me. Provide me some evidence, something where he actually, first of all, Malik, hold on, stop. First of all, can you define pandemic?
Why would I need to define pandemic?
Because clearly your definition of pandemic and what he thought is totally different from everybody else's. You asked me what I thought. No, I actually no. But also, I need some evidence. I need some evidence that he actually started the pandemic. He literally said on January 22nd. On January 22nd, on January 22nd, and that was a leading video. He said, oh, this is from one person from China. It's contained, under control. That's not a pandemic.
You asked me what I thought, and I said what I think that the president actually had felt that it was a pandemic.
Based on what?
What I also
based on what?
Well, if you just bother for one quick second to let me finish what I'm saying, what I also believe that we have a president who is the kind who will try to downplay it or, in many cases, overplay something to make him or his administration look good. So I believe that there are definitely people around the president who were saying that this is something that we need to take seriously. I believe that the president did take it seriously. I also believe that the president just chose to portray a different picture as far as where the government was at that time.
Kelly, I got to bring you in, because if you want the perfect example of a torturous word salad, that's what Melik just said.
Just listen to Roland show on
to actually suggest, Kelly, that Donald Trump thought this was a pandemic from the beginning, when his own words can be played back, where he completely treated this as not a big deal, did not see it as that significant. Kelly, go ahead, comment, please.
Well, to answer your question as to what a pandemic is, initially, the CDC defines it as an epidemic that has spread over several countries or continents, usually affecting a large number of people. That's what we have. That's why we're calling it a pandemic. 45, at the beginning of this pandemic, explicitly said that it was not a pandemic. He said that it was only contained to one person in China. Then he said you can get a flu shot and you'll be okay. And
actually said if you got coronavirus, go back to work.
Go back to work. So even if you've never heard explicitly him say this is not a pandemic, all of his messaging and all of his commentary thus far, up until really today, has been evidence of him saying this isn't that big of a deal. Obviously, that's not the case, because look at where we are right now as a country, where literally all 50 states, including some U.S. territories, have at least one case of COVID-19 in their respective jurisdictions. So yes, it is a pandemic. It's a problem. I'm not surprised that 45 lied. He lies. That is what he does. Unfortunately, I don't take what he says to heart. I take it with a grain of salt. And it's unfortunate, because that's supposed to be my commander-in-chief. We are supposed to trust him as citizens of this country to know what's going on, to be informed, to be cognizant, aware, and actually have our interests at heart. None of which is the case with this president. So I don't know what else to tell you other than the fact that, yes, he's a liar, and, get your information from elsewhere, like the CDC, World Health Organization, other places that actually have qualified.
Federal government. The federal government.
Michael, it is absolutely laughable to listen to this man stand there and lie the way he did by trying to say, I always thought it was a pandemic. I've always taken this seriously. We wasted a critical month because he did not take it seriously.
And I remember, early on, and I know you showed some of those videos, where he called it a hoax created by the media and the Democrats. He said that one time as well, which also wasted time, to your point, that it took away from about a month of getting prepared and getting tests. But I saw an interesting poll today, too, Roland, related to where his leadership is all about his base. I think it was like somewhere in the mid-70s of Republicans think this isn't that big of a deal, because that's what he's portraying, rather than saying, hey, look, everyone, all Americans, including my supporters, this is serious. We need to take it seriously. I do think there is going to be shelter in place, cities, states, probably nationally soon. I don't think there's, frankly, any way to avoid it with the numbers going up like they are. The question is whether he's going to lead or whether these governors, I don't know if you saw Governor Cuomo's press conference today, he was fabulous. He was a leader. He said, the buck stops with me. He laid out exactly what the roadmap was, what they were trying to do. And he said, look, there's only so much we can do. Federal government, we need you. We need you. Where are you?
Even Maryland's press conference today, and I'm not a Republican, but I have to give credit where credit's due. Governor Larry Hogan had a press conference today outlining, as much as he could, what the next steps were for the state, what was going to happen, what postponing.
Hell, he's taking it more seriously than Trump,
and he's a Republican.
We're
I'm sorry. No. Wait, Malik. Kelly finished. Then I'm gonna go to you.
Thank you, Roland. But even with Hogan, Hogan is a Republican. He's on record not necessarily agreeing with Trump at every point in turn. I actually don't think that he likes Trump all that much at all. I haven't read or seen anything out of Hogan's behavior or messaging that says that he aligns with this presidency at all. But he's still a Republican, and he's more of a traditional Republican than what we see out here today, which is just aligning with 45, regardless of what comes out of his mouth. So I have to commend the Maryland's governor for, doing even what Cuomo did in New York, is in just taking initiative, doing the best he can, seeking help from federal government when necessary, but using what he has right now until federal government gets their act together and actually does its job.
Malik, go ahead.
So I disagree with the fact that the federal government isn't doing its job. I think it's unfair. What we like to have a lot of high-level conversations as far as the political appointees, but I can assure you that there are career staffers in the federal government who are working their asses off. And so to continuously hear from, much like we're doing now, about the bad job that the federal government is doing, as someone who's worked in federal government, I just wholly reject that.
Well, first of all, hold up. You can reject it all you want to, but Dr. Fauci has actually talked about the delays and how there were some mistakes. I'm not done. There are government individuals who are admitting that they have messed up.
It had nothing to do with what Donald Trump said or whether or not he denies that he thought that there was a big deal or not. The federal government has been hard at work since day one.
But if they don't have a leader actually telling them what to do, Malik?
We have experts who are around the president, experts who give press conferences every single day, letting us know how the federal government is choosing to respond to this. So to say that the federal government, and only give credit to Cuomo or Larry Hogan, when the federal government is literally doing this every single day, so much information that the federal government gives us, they let us know today that this whole scenario about the World Health Organization sending
No, Malik, they lied. Malik, they lied. They absolutely lied.
Well, hold on.
Malik, hold on. Stop right there. Stop right there. You just said, hold up. You just said, according to what they said at the press conference. I just played for you a straight up lie Donald Trump told at the very press conference.
I'm talking about the actual test kit.
And hold up. And
the reason
Malik, that was also a lie.
Want that to come out.
No, actually, Malik, you're wrong. That was a lie.
I'm really not.
The problem.
So I'm not wrong. I'm relaying what the expert said today about the WHO test.
This is the problem right here. Okay. You will knowingly accept a lie. You will knowingly accept a lie.
That I'm right.
No, you're wrong. Michael, here's what's amazing. Michael, here's what's amazing. Michael, here's what's amazing. What's amazing. Malik, I'm talking right now. Michael, here's what's amazing. Here's what's amazing, Michael. Malik, I'm talking right now. Malik, I am talking right now. Guys, cut his mic.
You're talking now because I'm making a good point.
Cut his mic. No, I'm going to cut your mic. I'm cutting your mic. Here's what, and I've never done cutting the mic, but you don't want to listen. Here's actually what happened today. They were asked at the news conference about the WHO test. They talked about how the various tests had to pass a certain protocol. Here was the problem. It wasn't the WHO test that was failing. It was the CDC test that was failing. Michael, that is an undeniable fact. They tried to dance around this at the news conference, but that's a fact. The WHO provided 1.4 million of those tests across the world. The CDC test is what the problem was. Michael, go ahead.
And it all started whenever, I guess we can certainly debate when the first date was when we knew it was coming here. And the WHO, their first thing they are to do is to call the pandemic office at the National Security Council. But guess what? 45 got rid of that office in the National Security Council. So the WHO from the beginning had really nowhere or no one to coordinate with in our government. So our government got off to the wrong foot from the beginning because we didn't have those folks in place because he had to make cuts because of the tax cut, or he didn't think it was important. Either way, it was bad decision making. He clearly, and his government is not competent, doesn't know how to handle it. And I'm glad governors are saying, you know what? We need to move forward with how we need to move forward, and we'll just see what happens. If the federal government comes in, great. If they don't, we'll do our own thing.
Melik, this is exactly what was reported. This is exactly what was reported by a number of outlets that talked about the CDC testing. The New York Times, the Washington Post, the New Yorker, all of them. This is in the New Yorker. This is in the New Yorker. On February 5th, go to my iPad, 16 days after a Seattle resident who had visited relatives in Wuhan, China, was diagnosed as having the first confirmed case of COVID-19 in the United States. The Centers for Disease Control in Atlanta began sending diagnostic tests to a network of about 100 state, city, and county public health laboratories. Up to that point, all testing for COVID-19 in the U.S. had been done at the CDC. Of some 500 suspected cases tested at the centers, 12 had confirmed positive. The new test kits would allow about 50,000 patients to be tested, and they would also make testing much faster, as patient specimens would no longer have to be sent to Atlanta to be evaluated. The kits were shipped in small white cardboard boxes. Inside each box were vials. Inside each box were vials packed in stiff gray foam, which held the necessary materials. It went through this whole deal here. It said that the first batch of kits sent to more than 50 state and local public health labs arrived on February 7th. Of the labs that received tests, around 6 to 8 were able to verify that they worked as intended. But a larger number, about 36 of them, received inconclusive results from one of the reagents. And then it said, in a briefing a few days later, Nancy Messonnier, the director of the National Center for Immunization and Respiratory Diseases, said that although we hoped that everything would go smoothly as we rushed through this, the verification problems were part of the normal procedures. It wasn't a whole deal. The CDC test, they failed. In fact, it says, still, the 3-week delay caused by the CDC's failure to get working test kits into the hands of the public health labs came at a crucial time. That's where the failure was, not, Melik, in the WHO testing kit. It was in the ones that were developed by the CDC. That's what happened.
Well, I actually responded to the question that the reporter asked about the WHO tests, and which is why I responded that what our federal government said, that those tests did not...
I didn't even ask you about the WHO. So you say you responded to what the reporter... You said I'm responding to what the reporter said. How are you responding to what the reporter said when you weren't even there? You're trying to say...
Because I literally listened to the press conference.
So did I.
It was asked
So
in
did
the press
I.
conference.
So did I.
I'm telling you, I'm telling you the question that was asked in the press conference, and that's why I made the reference to what people are saying about the United States rejecting the WHO test. So I was actually explaining to you the government's rationale for that. And I do want to add something else. Tim Morrison, who's actually the director of the pandemic response unit that Michael actually referenced, well, what we found out yesterday in the op-ed that has been unrefuted at this point, in the op-ed that he had actually written on yesterday, what he actually said is that what happened is that based on information from not just Robert Gates, but congressional testimony and members of the Obama administration had said that the NSC had quadrupled in size since the Clinton administration. And so there should be a streamlining. What happened is that when Donald Trump came in office, they consolidated 3 directorates into one. And the one directorate that they have now is the pandemic response, and I think it's called the proliferation or something like that. But that is literally why that particular unit was disbanded. It was actually folded into one single directorate.
You're dancing
so that's
all over the place.
No. That's just information for your audience to know.
You're dancing.
Why
okay, but also that's a lie. The reason it's also BS because Senator Sherrod Brown sent Donald Trump a letter in 2018 about the disbanding of this office. You have had, excuse me, I'm not done. I am not done. What you have here is you have an administration that wants to move the goalposts and shift. Okay. Here's the reality. We wasted more than a month.
No acknowledgement.
We wasted more than I am talking. We wasted more than a month because the United States decided we want to develop our own test. Had we accepted the WHO testing kit,
that was not approved by the FDA.
We would be much further along, and the testing kits that the CDC had constantly failed.
That the government
they constantly failed. No, actually, what I'm saying is you probably wanted to get the WHO test and actually test it, but the CDC test is what consistently failed. All right, folks, back to our Roland Martin Unfiltered video in just one moment. All right, so a lot of y'all are always asking me about some of the pocket squares that I wear. Now, Robert don't have one on. Now, I don't particularly like the white pocket squares. I don't like even the silk ones. And so I was reading GQ magazine a number of years ago, and I saw this guy who had this pocket square here, and it looks like a flower. This is called a shibori pocket square. This is how the Japanese manipulate the fabric to create this sort of flower effect. So I'm going to take it out and then place it in my hand so you see what it looks like. And I said, man, this is pretty cool. And so I tracked down, it took me a year to find a company that did it. And so they make these about 47 different colors. And so I love them because, again, as men, we don't have many accessories to wear, so we don't have many options. And so this is really a pretty cool pocket square. Now, what I love about this here is you saw when it's in the pocket, it gives you that flower effect like that. But if I wanted to also, unlike because if I flip it and turn it over, it actually gives me a different type of texture. And so therefore it gives me a different look. So there you go. So if you actually want to get one of these shibori pocket squares, we have them in 47 different colors. All you got to do is go to RolandSMartin.com/pocket squares. All right, so first of all, that graphic is way too small. So tomorrow we're going to run it right down here all across the screen. So it's RolandSMartin.com/pocket squares. All you got to do is go to my website and you can actually get this. Now, for those of you who are members of our Bring the Funk fan club, there's a discount for you to get our pocket squares. That's why you also got to be a part of our Bring the Funk fan club. And so that's what we want you to do. And so it's pretty cool. So if you want to jazz your look up, you can do that. In addition, y'all see me with some of the feather pocket squares. My sister, who's a designer, she actually makes these. They're all custom made. So when you also go to the website, you can also order one of the customized feather pocket squares right there at RolandSMartin.com/pocket squares. So please do so. And of course, it goes to support the show. And again, if you're a Bring the Funk fan club member, you get a discount. This is why you should join the fan club. Now back to your Roland Martin Unfiltered video. You want to check out Roland Martin Unfiltered? youtube.com/Roland S. Martin. And subscribe to our YouTube channel. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. See that name right there? Roland Martin Unfiltered. Like, share, and subscribe to our YouTube channel. That's youtube.com/Roland S. Martin. And don't forget to turn on your notifications so when we go live, you'll know it. That's exactly what's happened. It's a joke. Folks, do we have the mayor of Atlanta?
Yeah.
If so, let's go right to Atlanta. Folks, it has 599 active cases of COVID-19 and 18 deaths, and yet Atlanta residents are not complying with their stay-at-home order. What the hell's going on? Y'all need to stay out them damn parks. Joining me right now is the mayor of Atlanta, Keisha Lance Bottoms. Mayor, what's wrong with these folks? Look, we done read thousands have died. People are literally dying. I'm sorry. I don't need to see some grass that bad and congregate with some other people.
Well, Roland, hello. I believe the last time I saw you, you were dropping me off at my house. So nice to see you again.
No, actually, I was in your car, and they dropped you off, so you hooked me up with the ride to my hotel. I appreciate that.
But now, you're right, it was a long night. But no, really, that story, in my opinion, was a bit overblown. People, by and large, have been complying with the order. We have the Beltline that runs through Atlanta. It's a beautiful walking trail that so many people are familiar with. And what's happening is that people are congregating there, and they are still going into parks and playing basketball. So we do have some problem spots, but what concerned me most of all, a couple of days ago, I got in my car and I rode from one end of ML King Drive to the other end. And, you know, in every African-American community, ML King Drive really is representative of the heart of the community.
Mm-hmm.
What did disturb me was what I saw during that ride, that many African-Americans, especially young people, are not taking this seriously. Congregating in front of, you know, the barbershop or wherever they're hanging out, all these places that should be closed. And I think what people continue to miss is that this is happening to us too. And even if you're asymptomatic, you're taking it home to your aunties and your grandmothers and your mothers. And we have all of the underlying conditions in the African-American community that make this virus deadly. We have asthma, some of the highest asthma rates in the country. High blood pressure, diabetes, you go down the list, it's prevalent in the African-American community. And so I think, you know, it really is about messaging. And I reached out to some of our local influencers yesterday asking, could they please put it up on their IG pages and talk to people in whatever way people will receive this message, because clearly they're not getting it watching network news. They've got to receive it in a different way. And people have to understand, no matter what your age is, people are dying.
Well, and you talk about passing on to the older people. Look, we've done the stories on the numerous numbers of individuals who are in their 20s, in their 30s, in their 40s, who are dying. Yesterday, we talked about one guy, he lost both of his parents, but we had of course, the young brother, a college student in Michigan, who, you know, about to graduate in a few weeks. He died as a result, got turned away as well. And so we're trying to explain to all of these young folks like, hey, you are not immune from this. A group of 70, these little rich white kids in Austin, chartered a plane a couple of weeks ago, went to Mexico for spring break. Now 28 of the 70 have coronavirus.
I mean, it's scary. And I even have this conversation with my 17-year-old son. I said, you know, so many kids smoke weed and they vape and do all these things that compromise their lungs.
Yep.
They're not going in nearly as strong as they think that they're going in. And for my son, anyway, I had to speak to him in terms of his brother who has severe asthma. They all have asthma. And I said, listen, you've got to understand, if you get sick and you bring it in this house, your brother could die. Any of us could die. I mean, you know, any of us. But when you're not coming in tip-top shape, which most of us are not, it makes you even more vulnerable. And so what I can say about Atlanta, I've been communicating almost daily with Dr. Carlos Del Rio of Emory University, and I'm following his lead. He was the one who told me 2 weeks ago, you have until March 24th to shut this city down if you want to have any hope of slowing the curve. We immediately shut down the city. Our governor just announced today that he is shutting down the state. So I'm glad that the rest of the state is coming along with us on this.
Way to finally wake the hell up, Governor Kemp. Way to finally wake the hell up.
Well, Roland, I'll just say better late than never. And I understand he had to go through his process and really understanding and really, I believe, hearing from President Trump that this is also hitting rural America.
But see that, but Mary, I get it. I understand. Look, I understand. But I look, mayors have been leading. Really what's been happening around this country, mayors have been leading, then governors. I can't get to the White House. I look at Mississippi. We had the mayors in Mississippi, including Mario King, Moss Point, Mississippi. They said shelter in place. Then what does the governor do? He then declares nearly every business in the state to be an essential business, overrules all of them. Then today he finally announces, shelter in place. Why? Numbers skyrocketed. They've been begging DeSantis in Florida to declare it. Nope, he wanted that spring break money. He wanted all of that. Finally today, he declares it. And you're sitting here going, y'all, these are people who are dying. I had the corner of Albany, Georgia, not even an hour from where you are right now. He said that's a city of 75,000 people, 71% black. Somebody went to a funeral and several people have been infected, and now in the city, 30 deaths in that county. And I just don't understand why people want to play around with this. This is deadly. In fact, go to my iPad, Anthony. You even posted your mama came by the house. You posted this photo. Your mama didn't come in.
That was from a distance.
Right.
She said she needed to lay eyes on us. So she cannot come in our house. And thankfully, my 17-year-old son banned her from our house about 3 weeks ago. He said that they were probably carrying germs and she didn't need to come in. So she said she just needed to stop by and lay eyes on us. So she was coming from the grocery store. We let her pull up in the driveway and we waited.
But again, though, the reality is you're trying to protect your son, yourself, but also your mother.
Yeah, I mean, and what I suspect is happening, what's happening to all of us, we know people who are sick. We know people who are dying. We already have at least 15 City of Atlanta employees who have tested positive. I have one friend who just had an oxygen tank delivered to her house today. She has been running a fever for almost 3 weeks. My college roommate's mother has been intubated and in the name of Jesus started breathing on her own today. She's been intubated for 2 weeks. And I'm sharing this because it's one thing for us to watch it on TV and we see how horrible it is in New York and these other places, but it's now in our faces and it's in our families and in our communities. And what I suspect with a lot of leaders across this country is the same thing is happening. It should not have to come to that, but we are where we are. And it's just my hope that as we take a moment and we breathe, and I understand people are afraid. What worries me, our domestic violence numbers are up. Our reports of child abuse are down. So we understand there's some underlying things that are happening even on top of this pandemic. And people are afraid about jobs and how they're going to eat. But what I've been saying to all of Atlanta is that if we don't get through this, we're not going to be alive to eat and to go back to a job and to do all these things that we consider to be normal. So it's a moment for us to take a minute, be still, and as leaders, our responsibility is to make sure that our people have the tools and resources they need on the other side of this. We've already started sending out locally from our economic development arm small business loans. We're not cutting off people's water. We're not towing cars. If you get financial assistance from our housing authority, we're not evicting you. So there are a lot of things that we've done, what I consider to be very common sense, proactive things to help relieve some of this stress. But elections matter.
Yep.
I'll just say that.
Yes, absolutely.
If we don't understand at this point that elections have consequences, I don't know what else will show us that.
Well, we're certainly seeing that, I think, out of D.C. To have the person sitting in the Oval Office, I can't call him president, sitting in the Oval Office questioning why do hospitals need so many masks and gowns. That, to me, is just beyond idiotic. You've got governors who are begging. Look, you announced last week nearly all the ICUs in Atlanta hospitals are filled up. They're being ravaged down in Albany, Georgia. I mean, this thing is happening, and you have someone who refuses to even deal with these companies who are also jacking up prices. These companies who are trying to charge hospitals $6 and $7 and $8 and $10 for a mask when they normally cost $1. You need leadership to say, hell no. Time of crisis, we're taking this thing over. In fact, I saw a video before I talked to you. The FBI raided the home of one guy who was hoarding some 5,000 boxes of masks. He was trying to sell them up in a massive markup. He got his apartment raided by the FBI. You would think the federal government would use the powers to say, if you're talking about this is a war, you have to act like this is a war, and you can't have companies jacking up prices and forcing city officials like you or hospital districts or counties or states to spend millions more for something that costs pennies.
You're right, Roland. And in the same way that our hospitals and our medical professionals need this PPE, we've got sanitation workers, we've got parks and recreation workers who are passing out food to kids. We've got police officers who need it. And what I just had a conversation with my team before going on with you. And what I said to them, when we finally get our PPE, treat it like you're getting some gold bars and some diamonds, because this is the hottest market for this PPE. And it is frightening when you see that our national stockpile has almost been deleted. And what it says to me, this is simply a lack of preparation. And so when I even look at our response from our city, there are a lot of things you plan for as mayor, and you have to anticipate things that may come up. I didn't anticipate a pandemic. And,
right.
But what I can say as a city, you are prepared because you have an emergency preparedness plan in place. You have reserves, your rainy day money in place, and you're able to mobilize. And what it looks like to me is the federal government was just caught flat-footed, as if this couldn't happen. And again, I'm taking it back to elections. This is why elections matter. You know, people would say, oh, he's going to get us all killed. I don't think anybody ever thought it would be through a pandemic. And when you don't have leaders who value preparation and who value all communities, then you are in a situation in the same way that we had to respond to Katrina because the nation didn't show up. Is the same way we're having to respond locally because we can't depend on our leaders at the top. And I mean that leader, not all of our leaders, that leader at the top. We've got to be able to see about ourselves as local leaders. And I'm just glad that governors and mayors across this country are making the tough calls.
Atlanta Mayor Keisha Lance Bottoms, we appreciate it. Stay safe, and thanks for all your leadership.
Thank you.
All right, then. I want to quickly go back to my panel. Scott, again, that's what leaders do. They lead. She gave the order before the governor did. The reality is there are people who were chirping at California Governor Gavin Newsom 2 weeks ago, but experts are saying his decision 2 weeks ago and the decision in Washington State has likely saved thousands of lives because they took the action. But here's the other deal. There were mayors who made those decisions in San Francisco, in Fresno, and this is the point. Lives are being saved because people took it seriously 2, 3, 4 weeks ago, unlike this idiot in D.C. In fact, we are now 1 hour and 7 minutes into this news conference, have yet to hear from Dr. Fauci, have yet to hear from Dr.
I want you to like, share, and subscribe to our YouTube channel, youtube.com/Roland S. Martin. And don't forget to turn on your notifications.
Martin.